muted? Yeah, thank you.
Baka yung ano yung dito sa
Recording in progress.
Okay. Okay, guys, we're about to go. Sorry, I was a couple of minutes late. Okay. Right. Alan, can you mute your microphone, please? Alan Anor, please mute your microphone. Thank you. That's it. Great. Right. Well, good afternoon, everybody. Thank you so much for coming along and joining us today. I'm sorry we can't do face-to-face meetings still. We have to do Zoom meetings, but at least it allows us all to join in. Veron, can you please mute your microphone? Please, Veron, mute your microphone. It's on the bottom left-hand corner. And Daisy, the same. Please keep trying to do that. I try and remind you, but I can't. I'm afraid there's too many people. I can't mute you all. I have to let you mute yourselves. Okay. So I know two participants have raised their hands. I'm sorry about that. I've just got to get on at the moment. Hopefully you can hear. We've just gone over 100 participants. So that's really good to see. So today what we're going to be doing is I'm going to be explaining to you the process of why we want nurses and senior carers. And, you know, I understand the vast majority of you will be senior carers. And I understand that, but there will be some nurses there as well. So I will be explaining the process for both of you, for both groups. And then please write down any questions you've got. And at the end of the presentation, I will be able to answer those questions, okay? So please just write them down, otherwise it will take us a little bit too long to get through, and I know some of you have work duties and have to go elsewhere. So I hope that that all makes sense to you. Okay, and as you can see on the slide there, my name is Philip Leonard. I'm the Managing Director of BA Healthcare. We have an office here in Malaysia, which is where I am at the moment because the internet's much better. And basically, we also, though at the moment, in the process of setting up a Dubai office as well. So that's actually set up. The company's already there. It's called BA Healthcare Gulf, and that's in Dubai. It's at the it's by the airport in the free zone there. But it's not staffed at the moment. My wife will be going down there to staff it with some other people, but that will be in a few months' time. So the other side of it is our UK company. That's really important because they are the ones that actually are organising and arranging the actual placements. And really, it's from our point of view and from my point of view, Rick or Dr. Richard Canavan is really important to the whole process. You'll see that we've sent, or I've been responsible over the last 20 years for sending over 7,500 nurses and senior carers to the UK. But that was between 2001 and 2011. Now, guys, this is really important to understand. From 2008, the UK government stopped allowing senior carers to come to the UK, and indeed at that stage, even nurses to come to the UK on work permits. So it's been 13 years since we were last able to send senior carers to the UK. That's all changed. In March, that all changed because we'll go through this as I go through the presentation, but mainly because of Brexit, which is the UK leaving the European Union, and the huge amount of European workers that were forced to return to the UK, from the UK to Europe, mainly guys because they had to get IELTS. Just as you have to get IELTS, and we'll be explaining that because that's really the critical thing. It's the same for even for Europeans. So it's opened up a wonderful opportunity for all of us. And really what I'd like to do is actually, can you please mute your microphones? Oh, for goodness sake, please mute your microphones. Come on, guys.
Okay.
Yeah, we can hear, all 130 people can hear you. That's what you've got to understand. Okay, so please mute them. I'm going to now play a video that Rick recorded yesterday. He apologizes, he got the date wrong. Please mute your microphone. Who is it that's still there? Let's see if I can mute you. Yeah.
Excuse me, Ate, the one you are on duty, can you please turn off mute your microphone, please, because everyone is listening and someone is
Mga kabayan, ang mga phone niyo po, paki-mute po, paki-pindot ng mute. Thank you.
Yeah, I'm just trying to mute some of you who are still unfortunately showing as still Mary Jane Maserati, or can you please mute your, oh dear, I don't know what it is, why it is you can't hear me. Veron, please mute.
Ako tao, memang orang
Oh,
Indonesia
I've cut your camera out, sorry. Sorry, I may have cut somebody's camera out. This is really complicated.
Maria just told me that our Zoom has to be setting up to, because some people want to in, but they are not allowed because there is a limit that I just know about it.
I didn't know about this. Apparently there's a limit, and I don't know how I can increase that.
Is there any setting?
I can't. It's sorry, that's going to be a problem.
Unless
I don't think I can increase the number. I'm sorry, guys. Well, I don't think I've got any choice. There are a lot of people can't get in at the moment. Please be patient. I think I've got to log in and log out so we can see if we can increase the number. I've just realized if we go over 100, it's a different process. So I'm sorry about that, guys. I'm really sorry, but I'm going to try. If I can't do it in 5 minutes, we'll just have to come back again. So please just bear with me, be patient. Okay, so please be patient, and I'll see to, I'll see if I can start this again. Okay, so sorry, didn't realize that. We haven't had 100 people before, so I didn't appreciate that we needed to increase the numbers. Okay, so I'm going to see what we can do. Okay. And as I keep saying, if you don't mind, make sure you have muted your audio, because it was really noisy. Maybe you didn't realize that your microphone is on. So you just need to mute that microphone. It's in the top, so the bottom left-hand corner, there's a little icon for microphone, and you just need to put, just click on it, and it will stop recording. Okay, so we're going to go back to the presentation. Just late starting. I'll catch up time. Don't worry.
progress.
Okay, guys, sorry. Let's try and crack on. We're still waiting for more participants to come back on, which they are doing. Whilst we're waiting for that, I'll give it just another minute to let people catch up. And those of you who are listening, thank you so much for your patience. As I say, we've never had more than 100, and I have a feeling we have to get a different Zoom package if we have over 100 people. And unfortunately, I didn't set this Zoom package up. Rick did in the UK, and he's camping today. So he's out and about with his family, and it's only about 7:30 in the morning for him. So I can't contact him to see if he could change it. Even if I could contact him, I don't think he could change it here and now. So I hope that that will solve the problem. I know I'm being told that it's in your settings panel. I'm just not sure. I'm worried about trying to sort that out. Thank you for the explanation. Next time I will get myself better prepared in case we have another 100 people again. So I'll be more ready for this. I've got 75 participants now. We've lost about 30 odd. So I'm just going to wait a little longer. Going up all the time. Yeah, so we're getting there. I think what I'm going to do is just play Rick. We're up to 80 now, so we're nearly there. I'm going to get you to listen to Rick's message, which, by the way, he apologizes. He got the date wrong. The 12th, he said it's the 12th of June. Of course, it's the 13th of June. I blamed it on him thinking it's British time or English time, but that doesn't work because they're 8 hours behind us. So we'll just wait, but somebody still has not muted their microphone. I'm going to have to get on, I think. I'm going to have to get on, guys, because time's running on. Okay, let's continue. So this is Dr. Rick Canavan, my UK partner. He runs the UK company, and looking very relaxed. And he did this yesterday afternoon. So hopefully we'll get his oh dear, we'll get his message. I just get fed up with technology at its best.
And welcome to our seminar on Sunday, the 12th of June, 2021. My name is Rick Canavan. I'm the UK Managing Director of BA HealthCare, and I'm the Managing Director of BAH Services, BA HealthCare's sister company in the UK. First of all, I'd like to say what a pleasure it is to be able to send a personal message to you. It's very sad that I can't join you live this morning or be physically in a room with you, but I'm very keen to send you a personal welcome, thanking you for joining us. I know that many of you, if not in fact all of you, are living under some form of lockdown conditions at the moment and looking forward to a brighter future. Well, I think today will tell you all about brighter future. I think it's possible to work with us and work with us to help connect you with UK employers. The opportunities in the UK have never been greater. COVID here is now almost at an end. More than half the population have had 2 doses of vaccine, and we're now inviting people in their 20s to receive their first dose. But the shortage of healthcare workers, of nurses, carers, senior carers, has never been greater. And the opportunities here are significant. And they're open to, I hope, all of you in the room today. We've never had so many people attend one of our events. And I'm looking forward to personally welcoming some of you here in the coming months. Just this week, it's been a very exciting week for us, I should say. Just this week, we've made a bold decision to expand our global network and to explore the opening of an office in Dubai. We've also sent out the first offer letters for nurses who will come to the UK as senior carers. They will come and work for HealthCare, a medium-sized nursing home and care home provider operating in the southeast at their Marlborough Court facility in Church Crookham in Hampshire. The 3 people who've been lucky to secure those jobs received their offer letters this week, and I'm now looking for a 4th person to join that group. The parent company of HealthCare, Anavo Care, have also asked us to source 2 groups of 4 nurses for their care homes in and around Glasgow, and are looking for us to become a long-term supplier as they build a number of new nursing homes and care homes over the next year, 2 years, 3 years. I'm also urgently seeking nurses to work with one of our care home clients in Exeter, in the southwest of England. And we have new inquiries every day looking for nurses and senior carers across the country. So it's a great time for you to be attending this seminar, a great time for you to be thinking about the future, thinking about what's possible. And for those of you who've got nursing and care qualifications, for those of you who have good English and want to work to make it that little bit better, but for those of you who really have the drive to make a new life for you and your family, there are huge opportunities here. Here. Thank you again for attending today. I look forward to welcoming a number of you personally in the UK in the future. And in fact, I hope to meeting a number of you in the interviews that we'll conduct over the next few weeks. So take care. Thank you for listening, and thank you very much for joining us today. And I look forward to seeing you in the future. All the best.
Right, well, thank you for that, guys. I'm sorry, it was probably my fault. I cut into the video a few times. I was trying to mute people's microphones. I may have, by mistake, muted your video, so I apologize for that. Anyhow, that was Rick. As I say, we've had a pretty successful week. That same employer, by the way, has also selected 4 senior carers as senior carers. In this instance, all 4 of them are Filipinos, and next week, by the end of next week, they should have their offer letters as well. So we're certainly going in the right direction. One of the issues that I've had is not having enough applicants with IELTS. So we cannot push hard with our employers simply because, as you can begin to understand, they immediately ask for applicants that have got IELTS, and if we don't have IELTS, it's going to delay the whole process. One of the aspects that we'll cover during the course of this chat is about doing our English test. And we have, I've amended the English test for this week. So what we'll be able to do is send you an English test to fill in and WhatsApp back to Eve, who will give you the numbers and everything later, for those of you that would want one. However, you'll have to request it. So you'll need to request. You need to request an English one. But don't do that yet. Wait till the end of the.
You did it already.
Please mute your microphone. Somebody there, very noisy. Please mute your microphones. Please mute them. We can hear everything you're saying. Thank you. So, that's something that we're doing. I would like to stress, please do not copy from your friends or get help. It will not help you. And sadly, I have 4 Filipinos. I'm mentioning Filipinos. 4 Filipinos, 2 of which must have cheated because they provided the same answers, the same wrong answers each. So those 4 I'm suspending until such time as we can sort this out. So please do not cheat. And again, I'm getting a bit tired of repeating myself. Please mute your microphones because we can hear you. Thank you. So anyhow, let's move on. So we're talking about, as I say, the UK deployment of nurses, senior carers, and nursing assistants, because these are the 3 criteria, the 3 areas that are included on the shortage occupation list. And why is that so important? Because that's what's not been available since 2008, so 13 years ago. Now we are allowed to bring them into the UK, and it gives so many of you the opportunity of being able to go to the UK and bring your families with you. And that's because the UK is still in crisis. We have a major need for nurses, carers, and nursing assistants. Unfortunately, we cannot take caregivers as caregivers. They must be senior caregivers or senior carers, because that is the immigration rules. It has nothing to do with the employer. This is what the immigration rules say. So there are some really wonderful opportunities in healthcare right now. But what are the reasons behind this? I'm just going to run through this very quickly. The main reason is that, we've had COVID-19 pandemic, which we're all still suffering from. I'm fortunate enough to be having my AstraZeneca jab tomorrow morning, all being well. So I'm booked to go and get mine tomorrow. But there's still many that aren't. But in the UK, over 76 million people have had at least one jab, one injection, and over 49.9% have had 2 jabs now. So we expect within the next 2 months to find that the vast majority, 80 to 90% of our population will be immunized in the UK, which makes it a much safer country to go to. However, they are expecting that those that come to the UK need to find a way of getting vaccinated themselves, because they're worried about quarantines and things like that. But that's really not a major problem. It's just something you need to be aware of. So I haven't quite finished on that one. Some of the other reasons that I'd just like to mention quickly is 48% of nurses are aged over 45 years in the UK. And that means many of them are actually in the process of retiring. There have been pay cuts, although some of these have been put back on the agenda. And in fact, you will benefit hugely by some of the new salaries. Out of interest, and I'll show you very quickly at the end of this presentation, on the offer letter from HealthCare, our nurses will be earning £27,000 a year as senior carers. And if you want to know roughly what that is in ringgit, that is 148,500 ringgit. And that's basic salary before we begin talking about overtime. So that's something to consider. The severe restrictions that used to apply have really been lifted to allow us to bring more people into the UK. And that's really important to know. So, these are some of the major reasons. And as I mentioned just a few minutes ago, the massive exodus of Europeans back to their own countries. And you have to understand it's because they now have to have a work permit just like you do, and they have to get IELTS in order to come to the UK. And many, literally thousands and thousands have not got IELTS and do not have a good enough English level to continue working in the UK. So what is their loss is going to be your gain. And that's really important to understand. I mean, just how bad is it? Well, we need between 100 and 150,000 nurses and senior carers right now. The NHS, that's our National Health Service, is the largest employer in the UK, and it's the second largest employer in the world after the Chinese army. So that gives you some idea how many healthcare workers we have. And for that reason, right now on the advertising, people trying to get jobs, etc. I mean, I'm talking about employers trying to find people for jobs. There are officially over 44,000 unfilled nursing positions, but that's just the tip of the iceberg. Why do I say that? Because we're just talking about those that are advertised. Because they can't fill these jobs, many jobs are going unadvertised at this moment in time. And as a result of that, in the government sector, only over 96% of NHS trusts, that's National Health Service trusts, are operating without enough nurses. And in the private sector, we still need at least 30,000 nurses there. But interestingly, there are more senior carers than there are nurses. So the demand for senior carers is even greater. And why I keep talking about senior carers again, whether you're a nurse or whether you're a carer now wanting to go to the UK, it is the most desirable route because the IELTS is only at IELTS 6, and that makes a real difference. So, you know, what is being done about this? Well, as I say, on the shortage occupation list, it's been extended in March, 4th of March this year, so only 3 months ago, to include senior carers. And we wouldn't have been having this conversation 3 months ago because it just wasn't possible to get you to the UK. Now it is. On the study side, because we do have people coming to the UK who want to upgrade their skills, perhaps go from a diploma to a diploma nurse to a bachelor's nurse or degree nurse. Again, they've now included the 2-year post-study working visa again, which means you can work for 2 years after you've graduated. I don't expect that to be of interest to very many of any of you, to be honest with you, but I mention it because it is another way of getting to the UK, but obviously you have to pay for the school fees, which makes a big difference. Will this solve the problem? Well, it could. There are tens of thousands of nurses who are qualified and would love to come to the UK, and senior carers as well. But you know, the main problem for most of them has always been competency in English. You see, the requirement to get IELTS 7.0 in order to have come to the UK, even as a nurse, was a real challenge for 90% of people. I maintain that probably 80% of English people would be unable to get IELTS 7. That gives you some idea of how difficult it can be. So when they announced senior carer route and the English language requirements, we realized that for senior carers, IELTS 6 overall would be good enough. And that means you could get, for example, 2 5.5s and 2 6s, or you could get, you know, 7.5, a 6, a 5, and a 5.5, for example, and you would still be capable of coming to the UK. Personally, I'm trying where possible to make sure that those of you who are taking that exam achieve at least a minimum 5.5 for any one of the 4 areas, which is listening, reading, speaking, and writing. And the reason for that is, as you can probably imagine, you're going to be working with your colleagues, you'll be working with clients, with you know, with their families, etc. And having a good command of the English language is really important. So, you know, it's just for you to know that that is what we're trying to do, is, you know, basically make it as achievable as possible for you to come to the UK, but at the same time ensure that we can manage your expectations as well as the clients. And that's why you'll be having not only an interview with myself or with Dr. Rick, but also you will need to be interviewed by the client. And then generally looking at how good your English is. That's the major reason. They're not worried about your experience, funny enough, but unfortunately, they may not be worrying about your experience, but you have to remember that there's an immigration process, and they will be. Can you please mute your microphone, whoever's there who's talking at the moment? Please mute it. Thank you. Oh, sorry. So is this just a British problem? No. You know, we've got a problem, 65,000 in Canada, 90,000 are needed in Australia, over 1.2 million. And these are just nurses, because these countries don't take senior carers. Only the UK is offering that at this moment in time. So that's, again, very important to realize. What's the opportunity? Well, we think it's all about creating supply, and that is actually managing, and that's why there are 100 of you listening now. I'm really sorry for the 30 odd that haven't been able to join in on this because of the limit I've found that we've got on our Zoom meetings. But what is so important is the fact that, you know, if you want to come to the UK as a nurse, qualify as a nurse, if you have already got your nursing degree, you have to come in at IELTS 7 and nothing less than 6.5. But if we're going through the senior carer route, whether you're a nurse or a senior carer, you would only need 6.0. And you might wonder why I keep repeating this, because honestly, guys, honestly, without this, you can't come to the UK. Okay, I've just paused for effect, because unfortunately, this is the minimum requirement. But now, that requirement at IELTS 6, and I know a lot of the people listening to this seminar or joining this Zoom meeting are from the Philippines, and I know your English is good enough to achieve IELTS 6 overall. But IELTS 7, that really is a challenge. For your information, 3 of the nurses that are going to Hestia who've been accepted, they've all got their IELTS, but only one of them has achieved IELTS 7. But she's going on the senior carer route because it's quicker, simpler, and easier for her to get to the UK. The other 2 didn't quite reach that limit, so they'll have to retake that either before they leave for their benefit or when they get to the UK. But the important thing is they can start their job, begin earning money, and begin learning what the job is all about. So they will work as senior carers until they can qualify as nurses. So that's another thing to be aware of. But you do need at least IELTS 6 if you want to come to the UK. Now, the proposition that we're looking at, and we're looking at for you, is more to do with the fact that, you know, we have a pandemic. We all know that, and we've had Brexit, which is Britain leaving the European Union. Both of these have played a major part. Quite often I get asked the question, is there an age limit? Well, can I tell you that we have 3% of our nurses in the UK now are over the age of 70. 3%. That's about 18,000 nurses are working right now, but they're over the age of 70. The oldest person I remember sending was 64 years old. The Filipino I sent from 64. She actually looked about 44, if not less. And she was very sprightly and very fit, because that's the other reason. When people ask you about their age, there is no age limit. No age limit at all. So if you're sitting there thinking, oh my goodness, I'm 55 now, don't worry. As long as you're fit and capable and healthy, you can still get a job in the UK. So that's important for you to realize as well. But we're looking, you know, we're looking for motivated professionals worldwide to come to the UK and create a new chapter in their lives. And all that remains to say to you at this stage is, are you that person? That's what you're going to look at. So having an understanding of the background, why it is that we need so many senior carers and nurses, I hope that now explains that part of it. The next question, and we're going through the detail of this and how much you earn That's normally when you get excited, when you find out how much money you can actually earn. We'll be going through that in a minute. And as we go through that, we will then do our best, you know, to explain all the different aspects to you. Okay, so let's move on. I've got a chat here. Just look, I've got people speaking in Tagalog, so I'm just going to have to ignore these messages. Okay, I don't know what they are. Okay, so let's move on. What I'd like to do now is read, or sorry, in fact, I think I need to go back a slide. I think I've lost a slide there. Yeah, I have. I should have mentioned Care England. Our major partner in the UK is Care England. They're the largest organisation that looks after private care providers. For example, Hestia Care, Anavo, and various other clients. They're all members of Care England. And Martin Green, I've known for many, many years. In fact, about 15 years, to be honest. And he supports what we're doing 100%. And that's why I wanted you to listen to a brief video from him, which is really, I hope, quite helpful in understanding a little bit more.
Hello, I'm Professor Martin Green, and I'm the Chief Executive of Care England, and we are the largest representative body for care providers in the UK. I know many of you will shortly be coming to the UK to begin developing your careers in health and social care. I want to say how welcome you will be and how your skills and experience will be very valuable in our health and social care system. I know that you will make a tremendous contribution to the work that we do to support both frail and disabled people. I hope that you will have a really good experience in the UK, and I know, as well as bringing a lot of your own skills, you will hopefully develop a range of new skills which will be very useful to you in your career, whether you decide to pursue that in the UK or indeed in your home country. It is always difficult arriving in a new country, but I can assure you that we will all welcome you, and we look forward to you working within our system to help us to support people. You and your families can be very proud of everything that you have achieved thus far, and I know that you will go on to make a really valuable contribution in the future, and I wish you all well.
Right, well, that was Martin Green. As I say, he's a really supportive person. He knows how, he was very involved when we were bringing over nurses before, and he knows how successful that was. And by the way, just so you understand the importance of the senior carer route, is 70%, that's 70% of all the nurses and senior carers we brought to the UK between 2001 and 2008 were or came in as senior carers, not as nurses, even if they were nurses. The other 30% was because the system was different then, and it was easier at that stage to bring nurses directly into the UK because you have what we call the adaptation program, different program to the one today. So it was easier for nurses still to come across. Why? Because they only needed IELTS 6 when they first arrived in the UK. And they had 6 months to get their English up to standard. Now, if you want to come in directly as a nurse, if you are a nurse, you have to come in with IELTS 7, as I said earlier, and 6.5 in writing. Whereas the senior carer route allows us to bring you all in at 6.0 overall. So what we're going through now is the process for admitting nurses and senior carers to the UK. I appreciate this, some of this will not apply to you if you're not a nurse, for example. It's not going to apply to you if you're a nurse. Some of the senior carer route won't apply to you. But I'd like you to listen in any case. And one of the appeals, and perhaps I'll just make this appeal now, is right this moment, do any of you know a male nurse that would like to come to the UK, with or without IELTS? I just need to find one right now for Rick. because the employer, that same employer, has also selected, as I said earlier, 4 senior carers, but they've decided they need also a 4th senior carer as a nurse. And the reason for that is we interviewed another person who wasn't successful in achieving the job. And there were reasons, nothing to do with her, funnily enough, it was to do with her status, her immigration status. And as a result of that, she's not been able to come. But now what we want is, they've decided they want another male rather than another female. So we have 2 female and 2 male nurses. At the moment, we've only got 2 female and 1 male nurse. They want another male nurse. And then, of course, on top of that, there are 2 groups of formal nurses that are required. He said for Glasgow, if you don't know where Glasgow is, that's up in Scotland, beautiful part of the world. And they are required, again, the reason of numbers of 4 is for sharing accommodation. So a house will be found with 4 bedrooms so that they can all share the same accommodation. That's why they need to be the same sex, either for males or for females. But essentially, I think it's more likely to be females because 93% of our applications for nursing or senior carers, in fact, senior carers, it's 98% at the moment, are actually female. So that's just another bit of information for you. Okay, so let's just start with nurses very quickly. We've covered most of this just as I've been chatting to you, but if you are a nurse, you need a BSc nursing, be a BSc nursing graduate or a diploma with a 3-year course, by the way. You're allowed to come in on that basis. You must be registered either in your own country or in the country that you've been working in. And as I've said already, you need IELTS 7, and the rest of it you can read yourself because we've already mentioned it. Okay, the process for admitting nurses to the NMC, that's the Nursing Midwifery Council, is a lot more onerous than it is for coming in as a senior carer, because they have to first of all get the IELTS, as we've talked about. They must then, once they've got IELTS, and only once they've got IELTS, they can do an online self-assessment. Once they have done that, they will then be provided a number so they can then do what we call the CBT, computer-based test. And from there, they then have to make their full application to the NMC. And only when they come to the UK do they have to actually provide all of their documentation when they do the OSCE. And the OSCE means Objective Structured Clinical Examination, which they can only do in the UK and only once they've been in the UK for 3 or 4 months. But that is the process basically for nurses. You'll see that the senior carer entry requirements are much, much simpler. You do need, and now everybody please listen carefully to this, because this, other than English, this is the other very important thing. Without this, I can't help you. You must have got a formal certification for being a carer or a caregiver. Somebody approached me the other day, they had 9 years experience, would absolutely be fine as far as the employer is concerned. But unfortunately, because of the rules, immigration would not accept them if they don't have corresponding documentation. Now, why do we say 6 months? It's got to be at least for 6 months. So I know a lot of you come from FEMA, and that you take that over a year, but of course it's not full time. Whereas in the UK, it's generally a full-time course for 6 months. If you're a carer or a caregiver in the UK, you only need the equivalent of a level 2 or even a level 1 initially. But to be a senior carer, and that's a very important word, the word senior, is because you will be actually looking after other carers, and you need to have some experience to be able to do that. The only, if I can call it this, the only way of avoiding this is if, for example, you're a nurse or a midwife or physio, some of the other categories that are mentioned there, and you already have a diploma or BSc in those qualifications. With or without experience, you would be capable of being able to undertake the role of senior carer, because the employer will always show you the whole system when you arrive. You will not be expected to suddenly be able to do the job. In fact, they won't trust you. I'm sorry to say that. Even as a nurse, you need to learn how the system works, as if you're working even as a senior as a senior carer. So I'm talking about even a nurse who acts as a senior carer needing to understand the whole system in order to be able to help other people. And again, as we've said, IELTS 6.0 overall in reading, listening, speaking and writing. So that's the much easier route. I also get asked, you know, what sort of job, what's your job? You know, what do you do as a senior carer? What's a typical task? Well, ladies and gentlemen, you're all capable of doing this. I know that. And if you just want to read down that list in front of you, you'll see what we're talking about. You know, oversee and monitor care workers, take responsibility for the shift and service whilst on duty, respond to any emergencies. The reason being, you could have a 16-year-old, quite literally a 16-year-old brand new carer who has no experience, not only in the job, but in life generally. And this is where if you're somewhat older, perhaps like me, you've got a lifetime of experience behind you, and you can therefore take charge of those situations. You know, assist service users, we call the patients or the clients service users. That's the sort of well-known phrase in the UK. To, you know, dress, undress, wash, use the toilet and bathe, all the things that you've been used to doing if you're a caregiver now. So I don't worry about that at all. And then obviously just generally assist with the overall comfort and well-being. Not just that, but also have a bit of fun with them. You know, arrange activities, play cards, play Scrabble, play Monopoly, things like that. Things to keep them amused. There are all sorts of activities arranged, like dancing and people coming in and singing. If you've got a good singing voice, you'll be pushed to the front to do some singing. So all of these things are aimed to stimulate and help our patients there. And by the way, it's not all about elderly people. In the UK, our hospitals are tertiary hospitals only. That means they only deal with accident emergencies, operations, and not long-term care. The moment you are well enough to leave hospital, you're either sent back to your home and visited in your home, sometimes by a carer, or you go into a residential home, which means you have no nursing requirements at all, a care home, which has limited nursing but doesn't require a nurse, and then nursing homes specifically, where you have to be a nurse. There has to be a nursing background because it's 24/7 there, and you have a lot of responsibility. So sometimes we've got patients there who are only 20, 25, 30. They've been involved maybe in a car accident. And as a result of that, you know, they found themselves in a position where they are in long-term care, perhaps because their families can't look after them. So although the majority of people will be over the age of 60, you will get a number of patients, perhaps as much as 25%, who are much younger. So our nursing homes in particular, as opposed to residential care homes, they look after those patients, those service users who have long-term needs, who need long-term care, because that doesn't happen in the hospital. So it's important to realize that. And of course, things like taking a temperature, pulse, monitoring their service, the service user, all those sort of things. Do a bit of light domestic cleaning, you know, cleaning around. You're not a cleaner. Let's make that clear. You're not expected to clean the establishment, the whole home, but you are expected to tidy up and clean around your patient, your service user, especially on a day-to-day basis when it's needed. So just be aware of that. And that it doesn't matter whether you're a nurse or a senior carer. In the UK, they do both. They're not limited to just that. So what's the process for admitting senior carers? As I say, so much easier. You know, IELTS 6, applicants must provide relevant documentation to the employer and to confirm, so that they can confirm the eligibility for the work permit, scanned copies only required, and provide supporting evidence of those documentation in the UK. It's a process which is much simpler and much quicker. Back to the, excuse me, back to the nurses for a moment. Nurses have to do a lot more. They have to do a test of competence. The first part is a computer-based test, 120 multiple choice questions, which they have to get the majority correct. And then they also have 2 attempts at that within immediately, or they have to wait 6 months before they can apply for a further one. Requirements for everybody, and this applies to whether you're a senior carer, is I don't want to read these all out, ladies and gentlemen, because if you move forward with us, as we get nearer the time, we provide you all this information. It's just obviously the basic ones, like a valid passport. You must make sure it's got at least a year left on it. Personally, I would always recommend that if you're going to go to the UK on a 3-year work permit, you should try and get 3 years on your passport at least, because it saves you mucking around in the UK and renewing your passport, etc. But it's not a requirement. Registration certificates for each country. Fergus, one of our successful applicants the other day for nursing, asked me the question, does he need it from Bangladesh? Because he originally came from Bangladesh, but has lived and worked in Malaysia for the last 5 or 6 years. And the answer is yes, you need to get a police report from both here in Malaysia, if that's where you are, or wherever you're listening to, if you're from Sri Lanka, or you're from Africa, if you're listening into this meeting today, you have to get a police report. Why is that? It's to ensure that you have nothing bad on your record, that you haven't done something awful in terms of to your patients, etc. And you will need 2 references, one from your employer, at least from your previous employer or your most recent employer, whichever. But guys, listen to me carefully. You don't have to get that yet. I don't expect anybody to go and get references until they have a work permit and all the rest of it, because I explained to the employers that if you were to actually request for a reference now, some of your employers would be very understanding, but others might not be understanding, and it could affect your current job. So we explain that to them, and you'll need a health declaration. This is voluntary, okay? This is voluntary for all of you, but I want you to think about it because I think it makes a lot of sense. I've always said it makes sense, to go and get a checkup, to do a medical checkup before you even make the application or as you're making the application. Why do I say that? Because in all my experience over all these years, quite often something shows up in when you actually have a medical test, which can be treated immediately by tablets, pills, injection, whatever. And by the time you actually make your formal application to the UK, it's already cleared up. The other side, which is a little bit not so nice, is if it is something seriously wrong with you, well, hard to say, but better you know now than find out just before you're about to make the application to go to the UK, because you will have to provide that when you apply for your visa. So just think about that. If possible, try and get a health check just to make sure, for your own benefit, that you know that you're fit and healthy. And you will most certainly need to have an X-ray for TB, for tuberculosis, because that's one of the main queries. But again, the detail for this we can advise you later on. It's just to give you some idea right now. And again, going back to nurses and the nursing route only, the NMC, the Nursing Midwifery Council, will aim to process your application from here within 60 days. That's before, oh dear, somebody mute their microphone, they've become unmuted. Please mute your microphone, thank you. And to make sure that you've been accepted by the NMC before you can actually apply to the UK. One thing I can tell you is once you get the invitation letter from the NMC, unless you've done something awful in your life, when they check when the entry clearance officers check for your visa, it's an automatic acceptance to the UK, because they know the NMC, the Nursing Midwifery Council's already cleared you. But this, please mute, please mute, please mute. Somebody's not muting, thank you. What is important to realize is that even if you go on a nursing degree, sorry, on a nursing work permit, you still cannot work in the UK as a nurse until you have completed and sat the OSCE, which I say is about 3 or 4 months after you arrive. So the objective structured clinical examination has to be done before you are allowed to register as a British nurse. And that's why the senior carer route for nurses, I think, is far preferable, because it means you've already got to the UK, you're earning money, and you're learning the UK system. Please mute your microphone. Somebody, please check and mute it. Thank you. Because it means you're already there in the UK and you're, oh dear, somebody's not muting their microphone and it's really crackly in the background. So if you could please do that, I'd be grateful. Okay. The objective structured clinical examination, which is for nurses only, is undertaken in the UK, as I say. It's undertaken by a number of universities, Northampton, Oxford Brookes, and University of Ulster. I'm not going to go through any more of that, I've told it already, but you have two chances to get this, 3 in all. But technically, if you failed, you would have to be returned to your own country. Now this, remember, is nurses only, so nobody else needs to panic. Why, again, I think coming in on a senior carer work permit route is better, is that wouldn't apply to you if you're on a senior carer work permit, because only when you pass the and were registered as a nurse, you pass the OSCE and were registered as a nurse, would the employer, the same employer you already have, would they then apply for you to transition from a senior carer work permit to a nursing work permit? But that will all be done by the same employer, and of course your salary goes up again if that happens. So it's actually quite useful to come in on that basis, because God forbid if you really did fail, and I remember having a nurse that had failed, again a Filipino male nurse, he never told us he'd failed his OSCE, applied to us, he'd gone to another company, but when we made the actual application it was rejected because we found out he'd been returned back, immigration returned him back to the Philippines because he had not passed the NMC. Remember, that is only for oh dear, we're back to the crackling sound again. Somebody's not muting. Right, let's move on. We're not got long to go now, guys. So if you're getting bored, I hope you're not, but if you're getting bored, we've not got long to go. What is the time? 3:24. Okay, so let's move on and get through the next part as soon as we can. Well, immigration requirements, and these really apply to everybody, but some good points in here as well. Please mute your microphone. First of all, you must be sponsored by an approved UK employer. And in fact, if you looked at the offer letters that were sent out by the employer, excuse me. I don't know who it is who isn't muting their microphone, but it's the same person because it's the same scratchy noise. So please check, make sure you're still muted. The employer must make sure that they've got their certificate of sponsorship before they can apply for a COS. Because that's a COS letter, certificate of sponsorship letter. It goes through, you go through as a tier 2 general visa, but you'll be under the shortage occupation list, and that allows your employer the ability of employing you at the same salary levels effectively as the UK. And that has been the challenge in the past because they expected overseas nurses, for example, to be paid a lot more money to justify recruiting from overseas and not from the UK. The shortage occupation list is what it says. What it says is what it is, which is we have these huge shortages, as I pointed out earlier, 100 to 150,000 nurses and senior carers. So that makes it a much easier process. But you again have to understand, all of you listening to this, that senior carers were only just now been accepted. It's not me crackling, by the way, it's somebody who hasn't muted their microphone. I don't know who it is, but somebody hasn't muted it. I see some chats. Let me pause for a second to see if somebody is saying that. Please mute. Yes. No. Yeah. I don't know. Galaxy A50, please mute. I think. Or was that unmute? Maybe I've muted you. I don't know. Sorry if I have. Anyhow, I'm sorry. I've got to carry on. Please unmute. Remit note 10. Remit note, please unmute. I think it's mute. Anyhow. So what about the other benefits there? You start work as soon as you arrive in the UK. As soon as you get off the plane, you're being paid by your employer. Even if they want you to have a few days off to acclimatize or to do any training, you're still paid. It makes no difference. So don't worry about that. You're also allowed to do a second job in the same field or practice for up to 20 hours per week. And I'll cover that in a further slide in just a minute. But that does mean for those of you who are keen to earn as much money as possible, there's the opportunity of doing so, whether it's through your existing employer or through somebody else. And that's important to realize. You can also undertake voluntary work or study. And I do get people saying, can I study? Can I do a BA, or sorry, not a BA, a master's degree, an MA or whatever? Yes, the answer is you can in your own time, as long as it doesn't interfere with your job. And probably the most important one is your multi-entry visa, and the fact that you can bring your spouse, that's your husband, wife, or partner of more than 2 years, and any children you have under the age of 18 with you. And your spouse, this is really important, your spouse is allowed to work full time, meaning 2 possible salaries. And children receive free schooling under the age of 18, because you cannot bring children who are over the age of 18. So that's also very important. The multi-entry visa, well, I always say that if you're really rich and you've got so much money that you can afford it, you can afford to fly home back to your own country every weekend. It just might cost you rather a lot of money. But multi-entry visa is what it says. You can come and go as you like. And that's, again, important. So, and just mentioning that, like holidays, for example, you get about 5.4 weeks holiday a year, including bank holidays or public holidays. So that's another point for you to remember as you go forward. Okay, I've just lost my, there we go. Eligibility, well, as I said earlier, you'll get a certificate of sponsorship, a COS, and a reference number on that COS will allow you to go to VFS Global. In most countries, VFS Global, like here, in India, in the Philippines, VFS Global is the organization that actually manages and arranges for visas to be issued. So you'll get that number, which is a unique number, which they can double check on their system to ensure that your employer is a legal employer who is legally allowed to employ you as a senior carer or a nurse, because they have direct access to that file. Without that, you can't get a visa. And you'll then need to take with you standard things like a current passport size, color photograph. You have to do your biometrics, that's your fingerprints. And of course, you have to have IELTS at the required level for whether you're a nurse or a senior carer, and any vaccinations. This is a slide I put in last time I did this, because I think it's quite useful, because a lot of people say, well, what are the requirements for my partner, for my husband, for my wife, for my children, etc. Well, basically the documents are all the same, but if you have adopted a child, for example, you need to provide the adoption certificate papers as well. But essentially, what it does mean, and I really want to stress this, the employers feel the same way that we do from the experience we've had. Please, please, please do not bring your children or your husband, wife, partner, whatever, with you initially. Give it maybe 6 months. Find a job for your partner or help find a job for them. Find schools for your children. Seek out and sort out accommodation, because it's all very expensive when you try to do it from here. And when you first arrive in the UK, you're going to find that quite tough as well. And it's expensive to apply for the visa. You have to apply for the visa. Your employer will not pay for your spouse or your partner or your children. So if you have 10 children, it's going to cost you a lot of money. So I would suggest you think carefully before you do this. And you have to think of areas such as childcare, etc. It's very expensive in the UK. So really, if you're coming across with a partner, you have to work shifts and things like that to avoid having to employ outside people. It is possible, by the way, for your parents, the children's grandparents, to get a family visit visa, maybe for up to 5 years, and that would allow your grandparents or your parents to come into the UK for 6 months at a time, a maximum of 6 months at a time. So, of course, the clever ones amongst you will realise that one grandparent can come in, or one parent can come in for 6 months, go home, and the other one can come across for 6 months. Or if you've still got all 4 parents, or for you and your partner, well, they can do 3 months each, or 2 lots of 6 months and come together. They're not allowed to work, but they can come and visit. And that sometimes creates a method of childcare which is effectively free. And you just have to look after your parents and pay for their costs. So please remember that. And I've just noted there, although we're going to go into salaries, I just want you to know that the basic minimum salary applicable from April this year, which has just gone past, is £8.91 per hour. That's the minimum wage a person like your partner can earn. And so if you look at that in terms of ringgit, it's effectively 50 ringgits an hour. Okay, so your husband, wife, or partner. Why do I say partner? Because it can actually even be a same-sex relationship. In the UK, we don't differentiate, but you have to be able to prove that you've been together for at least 2 years in order to apply for that. But it does give opportunities for boyfriends and girlfriends and fiancés and things like that to come across as well. Okay, I will ask one more time. Somebody still hasn't muted their microphone. I'd be grateful if you did. Okay, guys, we're nearly finished. We're nearly finished. And normally this is where you all begin sitting up and listening much more closely, because we're talking about how much will you earn? What is going to be your salary? Now, before I click on the next slide, I want to make this very clear. These are effectively minimum, I'll repeat that, minimum salaries that the government insists that employers pay at the very least. And I'm sure you do understand that there are different parts of the country where the salary scale is different. For example, in London, you get more money because the cost of living is more expensive, like rental, etc. But perhaps somewhere like, I don't know, Sheffield might be a lot less expensive because the cost of living is less and accommodation is less. So you tend to find that your salary is determined by where you live. But it is possible to earn less salary, but actually keep more money because you live in an area or you're working in an area where the cost of living and the cost of accommodation is lower. So please keep that in mind. So these are the basics. And the first thing to say is, as a senior carer or a nurse, the minimum salary per year is 20,480. Okay, 20,480. That's again round about well, I don't know, it's around about 150,000 ringgit, I would say. Now, once you become a registered nurse, your salary will go to at least 25,000. But I'm telling you now, most people will earn between 30 and 35,000. At the end, I promised to show you some letters. You won't probably be able to read them carefully, but I can tell you, as I said earlier, that the actual annual salary for the 3 nurses who've been selected, who are coming in as senior carers, whilst they're a senior carer, they're going to earn £27,070 a year. £27,070 a year. Now, that's before overtime, that's before they do anything else, and more importantly for them, before they qualify as a nurse, because automatically their salary will go up £5,000 or £6,000 as a nurse. So that gives you some idea. But this bit in red that you can see, allowed to work further 20 hours per week for an alternative employer, this is to allow you to get more hours if, for example, your employer wants to keep you to minimum hours. Now, I will tell you what we try and do, and we've managed to negotiate that with this particular client, and that is they have agreed to the senior carers earning 48,000, sorry, working 48 hours per week. Now that may sound quite a lot to some of you, I don't know, but let me put that into perspective. What we're talking about is 4 days work with 12-hour shifts. So that gives them 3 days off every week, and that changes every 2 weeks. So 1 week you'll be working during the week of weekdays, another week it'll be part weekdays, part weekends, and that changes on a rota every 2 weeks with them. When they get to Christmas, they will give you 4 weeks notice. And I can tell you now, if you don't have a family and children in the UK, because by the way, it's not possible to take holiday over the Christmas period. That is a no-no with everybody. But what normally happens is if you're happy to work Christmas Day, it's double pay. So for the Christmas Day, you get paid twice as much on an hourly basis as you would normally. And the reason for that, as you can probably imagine, is there are many British nurses and senior carers who would love to have Christmas Day off to be with their families. And normally they can't. So they'll love you if you're prepared to work a Christmas Day. And actually, it's great fun. It's great fun because there are parties going on. And I'll say this to you honestly, because I've had a lot of experience of this. It's a lot better than sitting in your room at home on your own, staring at the four walls on Christmas Day, because it can make you feel a little bit sad or homesick. So better to work and get paid twice as much money. And that's the other point about this 20 hours a week. If you're working, which you can do for an agency, often you can get 15 to 20 pounds per hour, an extra 300 to 400 pounds per week for that extra 20 hours. But again, you don't have to work 20 hours. Maybe you just want to do one more 12-hour shift, which is 12 hours, and you'll be paid at a higher rate. That would still give you 2 days off. So just to be clear, that even if you have a 48-hour contract, 48-hour a week contract, you'll only work for 4 days because each shift is 12 hours long, and you'll have 3 days extra where you can either work more hours for them, your employer, if they want it and you want it, or you can just have the 3 days off and you can study or do something else, visit friends, etc. Or, you know, you can work part-time. It won't matter. Okay. And it's funny, the next thing which I've said, which is how much tax are you likely to pay? I got a call the other day, now that someone's going to the UK, couldn't remember how much tax are they going to pay, what are they going to have to pay? Well, let me just tell you that the first £11,850 that you earn is tax-free. You don't pay any tax at all on the first 11,850. And then the difference between 11,850 and what you actually earn, you'll be charged at 20%. So if you were earning, just as an example, £31,850, you'd be charged, you'd pay no tax on 11,850, but you'd pay 20% on the other £20,000, which is £4,000. And this is deducted at source. That means it's deducted directly by your employer. That's part of the rules of the regulations as well. The only, and then you'll notice that if you then salary goes over 46,350, for the amount over 46,351, so if you suddenly were on 50,000, I worked out it's possible for our senior carers now earning £27,000. If they were to do an extra 20 hours per week, they could very well be earning £50,000 a year. Sounds incredible, doesn't it? But it's possible. But that would mean doing 68 hours a week per work per week. But they would be then on that 50,000, the difference between 46,351 pounds and 50,000, they will be taxed at 40% of that, basically 3,700 pounds. So that's how it works. It's on a scaled basis. As I say again, 11,850 is tax-free, then 20% up to 46,350. So most of you won't have to worry about paying 40%. And if you do, you're really earning big money. So I hope that gives you a good idea. As I say, if you've got any questions on this, I will answer them at the end. Now, how much does it cost? This is the next big question. How much is it going to cost you? Well, in reality, in fact, what you pay yourself is effectively nothing. Effectively nothing. But I will explain to you and go through the fully refundable surety bond. And it's boring going through it, but I need you to understand that the employer is going to pay out for your work permit round about £3,199. The £199 is not refundable at all, and the other 3,000 is possibly refundable in full, but not necessarily. And he has to pay that. And why am I mentioning this? Because the surety bond is to ensure that once you have done your IELTS and you've asked us to find your employer, that you are prepared to pay the £200, that covers the £199 we're talking about, and is fully refundable in the UK when you arrive. But if you decide, for whatever reason, suddenly you don't want to go to the UK and already the employer started the whole process, he will lose money. So we will refund that to the employer. We'll make sure he's not out of pocket. And why do we do that? Because if you drop out or back out at the last minute, he's got to find a replacement, and he has to go through the whole process again, including getting permission to employ another person to take your place, even if you haven't even gone to the UK yet. The second part is what we call the immigration skills charge, which is the ISC, and that's £3,000. And that is a big ticket for the employer to have to pay. And all of this has to be paid up front before he can make the application for your work permit. Now, what we've said, excuse me, what we've said is we are asking for a 10% deposit from you, again, on the basis of if you were to back out, don't go, whatever, then that money would be forfeited. You'd lose that money. But as long as having been off, so first of all, you've got your IELTS and we're now finding you a job. Secondly, we've got you the job and you're now going to the UK. Once you arrive in the UK, the employer will help open a bank account for you and he will put that money into your bank account. So you'll have effectively £500 waiting in your bank account. So look at it more as a deposit savings than anything else. And before you ask the question or think about it, what happens if we don't find you a job, or what happens if the job falls through because we have failed to get it for you? Then if that happens, you'll be refunded the money. Okay, so that money will be refunded to you. So please be aware, this is not a fee of any sort. It is surety bond. And we've had to do it, ladies and gentlemen. Why? Because sadly, we've had situations over the years where for whatever reason people have dropped out. It will always look sympathetically at the reasons behind it. And there are some times when we will agree to waive that fee and pay you back in any case. But we are trying to stop people making an application thinking, well, it's not costing me anything. I don't have to, there's no cash out, for example, nothing like that. So let me just try this on. And if nearer the time that something better comes up, and I want to go to Australia or I want to go to Canada or somewhere else, well, it hasn't cost me anything, so it doesn't matter. Well, it does matter, ladies and gentlemen, because not only does it damage your credibility and our credibility and reputation, there's a real physical cost involved that the employer will have to pay whether you go or don't go. Now, on the immigration skills charge, yes, it's possible for them to get most, if not all of that money back within 90 days, depending on the circumstances. But with the work permit, the £199 work permit, no, they won't get that. So they lose that money, and we use that by refunding that money. It means the next person pays for their processing all over again and puts the same surety bond up in the same way, and they'll get their money back in the event they arrive in the UK. The IELTS exam fees vary. Here they're 895 ringgit to do the exam. I always suggest you do it with the British Council. Why do I suggest that? Because they give you what they call the road to IELTS, the road to IELTS. As soon as you have paid and booked your date, they will give you that, and that's a really helpful tool to answer all your questions and allow you to practice in your own time, especially on areas where you feel weakest. And that applies even if it's speaking. Within that, they have the ability for you to be able to practice right up until the time you take the exam. I will say again, please mute your microphone, whoever isn't doing it. And then if you're a nurse, oh, by the way, we are arranging with the employers for you to get that £150 back, again, when you arrive in the UK. So keep your receipt and your payment, proof of payment to the British Council or IDP if you're going to use them, and bring that with you to the UK, because your employer will reimburse you that £150. So as I say, it's not even costing you anything. If you're a nurse, you'll have to do the Pearson VUE computer-based test. That's 120 questions. It's £83. And you'll also have to pay for the application fee direct to the NMC for your final application in order to get approval to come to the UK. Both of those costs will be reimbursed to you in the UK if you choose to make that application from here. So again, really, we can't be fairer. You know, I heard the other day, I was talking to somebody working within Sri Lanka, and we heard that there was a company there charging the equivalent of £9,000 to get them a job in the UK. We are charging you nothing, ladies and gentlemen, nothing. But we are asking you to be a serious partner with us, to accept that there is a responsibility on your behalf, and you must be prepared to pay for the surety bond, because we will not process you otherwise. And, you know, as I say, that is fully refundable. You'll have that in writing. You'll have an agreement that you will sign and we will sign. So you have legal recourse to get your money back, etc. But we have to know that you are really, really serious before we ask the employer to start the process of applying for your work permit. Okay. So what about these other costs? Well, again, these are costs that the employer will be paying, will be responsible for. He will pay the £199, which I've already said. You will have to pay £232 for a visa here, and obviously any dependents that you have. But ladies and gentlemen, he will refund you the £232 in the UK when you get there. So again, you won't be out of pocket. Obviously, if you are refused and you can't get a visa, that is a cost that you will have to bear. We hope that nobody will be refused, but that is always a possibility. But don't even panic. You won't apply for your visa until you've already been issued a work permit. It won't have cost you anything yet. But if in the event that you do fail, unless it's because you have been in some way untruthful, or you have falsified your documents and they've found out about it, something that is clearly your responsibility, then if it's not any of those sort of things, we will appeal it. And we've always had huge success on appeals. Why we had huge success? Because generally speaking, we are only ever applying for people once we know that we've got every chance of getting that work permit and visa. We don't want to set you up to fail. We don't want the employer paying out money for no reason, for the reasons I've already given to you. The UK immigration skills charge of £3,000, I've already mentioned. The employer pays that. He has to pay that for you. And please mute your microphone, whoever has got a child and a couple of children with you in due course. If you're a health worker on the approved list under the SOL, the shortage occupation list, they are free. So that's really good. That's applicable for everybody. Again, for nurses only, the OSCE, the Objective Structured Clinical Examination, which is payable in the UK and can only be done after 3 or 4 months. Often the employer will either loan or pay this fee for you, £794. But that's not something to worry about now. That's 3 or 4 months down the line once you've actually got to the UK. And also, once you have passed the OSCE, if you're a nurse, you have to pay for your nursing registration. And let me be honest with you, I do not ask the employers to pay that for you, because I believe it's really important that you pay that for yourself. It's your PIN, it's your personal identification number, it's your nursing registration. And if after the end of your contract, after 3 years, you decide to go and work for somebody else, you will need that in order to get a job in nursing. That's £153, but remember, that's only if you're a nurse. And now we're really at the end, and I just want to go through with you very quickly before we get to questions. What do you do next? So obviously the first question would be, are you interested? Are you genuinely interested? Well, if you are, we need either our application form filled in, or more importantly, we need a resume, a comprehensive resume of what you have done. And if you're working in IT at the moment, or in a service position, and have done the FEMA course, for example, doing it, it's really important that you focus that resume on healthcare. The information that you provide for other areas can be really important, especially if you've been in any way a team leader or had any management experience. And again, if you happen to have a degree in another discipline, like IT or business or whatever. And the reason for that is it allows us to justify on behalf of the client the reason why you are not just a carer, but you are a senior carer, and you have the ability to manage people as well as managing yourself. As I've said to you earlier on, the employer's less worried about this than I am, because I'm always thinking of when you make the application for your visa. You've got to be able to identify that you have the necessary qualifications to take that position. And I want you to think about this very carefully, everybody. And why I say very carefully, because, a lot of people will try and abuse this system to get to the UK. And, UK VI, that's UK Visa Immigration, and the entry clearance officers are very aware of this. So you need to understand that they have a checklist. And that checklist means they need to tick or check every box. And so, excuse me. Sorry about that. I should have got myself a drink earlier. So what you have to understand is they are looking to ensure that on their checklist, you meet every requirement. So even though your employer may be very happy with your experience, like that person I mentioned who had 9 years experience, without a certificate to back that up, without that certificate, the problem they're going to have is they will be questioned and possibly their visa refused, simply because they don't have the qualification that shows that they have at least a level 3, an MBQ or a diploma at level 3, which we discussed earlier. Okay, so that's the first thing that you have to think about. And of course, this will be based on IELTS 6 or OETC. If you haven't already taken the IELTS, arrange to take the IELTS. And what I've been doing, to be fair to everybody, is as you pass the IELTS, please mute your microphone, somebody. It's the same person, they just have not muted their microphone. So as you progress. And as those people book, if you haven't already got IELTS, if you've got IELTS, fine, you'll move to the top of the list. If you haven't got IELTS, I'm taking it on a first come, first served basis. So the first 4 senior carers who were selected 2 weeks ago now for Hestia, those 4 all had booked their IELTS. One of them, Frida, congratulations, Frida. I don't think you're listening, but if you know her, she passed IELTS and she got the required level. The others have got, I think they're all taking it this coming, or next coming Saturday, I think the 19th. And even with the pandemic on, exams, you can still go and take your IELTS exam. Others have booked them going into the end of this month and into July. So I now have a further 6 people who will now form on our list for the next ones to be interviewed for senior carers as senior carer positions. And the same applies for the nurses, although at the moment I have more positions for nurses than I actually have with IELTS. So, as I say, if you can find between you, and I'll just remind you, we're looking specifically for one male nurse. If you know a male nurse, unfortunately, they cannot be in the Philippines if you're Filipino, because we haven't yet got you may already know, the Philippines have now put a cap or ceiling, not only a cap or ceiling, they are suspending any nurses or carers going overseas, in healthcare people overseas, although we're hoping that that will be lifted quite soon. Some of you may have seen the interview. You can see it on our website if you go to the website, which you can see it's www.ba-healthcare. The message from the Prince of Wales, our future king, saying what a wonderful job Filipinos have done, the nurses, etc., have done. So we hope that'll be lifted. But right now, that nurse has got to be in another country, whether it's in the UAE, whether it's in Africa, whether it's in Sri Lanka, whether it's here locally in Malaysia. We're looking for one right now. It's really urgent because they want, if possible, the 4 people to go together. But even if they haven't got IELTS, they've got time to take IELTS while we're going through the process. So really and truthfully, what we want to be able to do is make sure, as I said earlier, that you agree that you'll pay the surety bond in the 2 parts that we've said, once you've got your IELTS, and then secondly, once we have a confirmed job. So until you get a confirmed job offer and you've signed and returned that form, you don't have to pay anything more in any case. And then you'll send your application form, resume, passport. We need the passport name page. Now, again, very importantly, guys, a copy of your existing visa. Even if it's run out, even if you're renewing it, we need to see that. We need the information that's involved in that. And then your certificates, if you have any, your transcripts of recording, transcript of record, your certificates, I say, your IELTS once passed, and in due course, the references. You can either WhatsApp that to the WhatsApp number shown there, which is Eve, and she's admin at BA Healthcare, so WhatsApp it, or I would actually prefer it, if possible, if you can send it by email. But I understand for some of you that's very difficult. Or if you've gone through a agent, especially if you're in Africa or Sri Lanka or whatever, talk to your agent first, and either they will inform you to send it to us or you'll send it to them. I think I'm right in saying that with Salio here, she's quite happy that you send all your details in, because one of the things that we've done is obviously we have our seminar lists. So we have your name and number of all the people that registered for this. Eve will be checking those off against the numbers on our list, and we'll know who did attend and who didn't attend. And what we'll be doing at the same time is, if you want to go further with this and you're interested, you will need to WhatsApp us and say, please send me, I'm interested, please send me the English test. And then be a bit patient, because Eve's got to get round to sending it out to everybody, but she will then send that to you. What we do ask you, and we will note this, is you must please return that within 24 hours, within 24 hours of it being sent. Otherwise, it'll become null and void. But we can WhatsApp that to you, or we can email it to you. But please remember that. And don't cheat. Sorry to be blunt, but please don't cheat. It's not really going to help you, and it's not really going to help us. And it will get whoever, if somebody helps you, if it's another applicant, it could get them into trouble as well. And let me just again remind you, the reason I'm asking for this is that I go through every single one of your replies. And I like to believe, with all the experience that I have, and being English myself and having a very good command of the English language, I can go through your questions, because quite often the answers that are expected are not the ones you give. But similarly, if somebody who really understands English will know that you can have 3 or 4 different answers for the same question. So I look at everybody's test myself, I score it myself, and I then ask Eve to send it back to you with the results. Now, this is where I'm giving you advice, because I'll be saying to you that I believe you'll be at IELTS 6 or 6.5 or 7 or 5.5, and honestly, if you score really low on my test, because it's based on IELTS, then I will be advising you that don't apply yet. Do not apply for your IELTS yet. Don't go and sit the exam yet, because you are almost certainly going to fail it. You need to do some training. You need to perhaps go on a course, and maybe it'll make you really think, do you want to go down this route? Because it will cost you some money and time in order to make sure you can speak English clearly and be able to pass the test. So that's why I'm asking you not to cheat, do it yourself. And if somebody asks you, can they copy yours or look at yours, just say no. Remember what Sir Philip said. Remember what he said, I could be excluded from going to the UK if they find that happened. And if you really honestly want to know how I can find out, is that unless somebody gets 20 out of 20, in which case I cannot really check. For anybody that gets 2 or 3 wrong, when I see the same wrong answers, some of them are quite bizarre, quite strange, some of the answers that come back, then I can be certain that one or other of those people has actually cheated. And we check them all. So, as I say, believe this or not, this is for your benefit. It's not for my benefit, it's for your benefit. But it will save you time, money, and effort if you make sure you complete this yourselves. Before, as those of you who came before would know, when we have a live meeting here, seminar here, those that attend that seminar can complete the form after the seminar, and it's all done in our offices. Obviously, the MCO and lockdown makes that really quite impossible, especially since it's been extended to the 28th now. So we have to trust you. We have to trust you, and we'd ask you, please, please don't cheat. You know, please make sure that you honestly answer those questions. And the steps after this, well, there's only 2 more slides left, basically. One is for nurses only, make the initial application to the NMC. To do that, you must already have IELTS, and then receive an invitation that authorizes you to take the CBT, the computer-based test. The CBT is 120 multiple choice questions, and that has to be taken at the nearest Pearson VUE center to you. Okay? If you're in KL, for example, or in Malaysia, there are 2 or 3 centers you can go to. If successful, then you make the full application to the NMC. That will take up to 60 days to get an acceptance or a decision, although usually they can do that, they usually come back within 30 or 45 days. You then receive an invitation from the NMC to come to the UK to take the OSCE, Objective Structured Clinical Examination, in the UK. That is the authorization we need in order to give that to the employer so he can apply, she can apply for your work permit. That is it. That's just for nurses. There's no other requirements for the senior carers. As a senior carer, what you've got to remember is whether you're a nurse or senior carer, you're now ready to come to the UK. You will need to undertake your medical, including TB X-ray. At this point, in fact, normally before this point, we will be able to confirm your sponsor, your employer, and arrange for you to travel to the UK and join your new employer, who will pay for your visa and air tickets and will arrange your accommodation. Now, as I said, with the visa, you pay for that first, he will reimburse you. With the air ticket, he will arrange for that, okay? And why do I say at this point and not before? Well, it may be possible that you'll have 2 or 3 different employer choices, and it may go right up to the wire as to which one you'll go to, depending on their immediate requirements then and the speed with which they can process your applications. So it's not black and white that you'll just have one employer. As we build up, from my prior experience, we'll end up with multiple employers, which is a great opportunity for all of you once you have your IELTS as the first start, as the first step to come to the UK. And as I said earlier, your salary entitles you to be paid upon arrival in the UK. Okay, so you know, we really try to be as fair as possible, and we'll help you all the way along the line. And I'm not expecting you to be able to read these letters unless you've got X-ray sight or vision or whatever. But this is the process for offer letters with HealthCare, for example. So what happens is they issue the letter, it goes to our UK office. That UK office then issues the letter to you, or to me rather, or via me. I then put a following letter which will change slightly because, for example, in this last application, Tulsi, one of our applicants, already has IELTS, so there's no requirement for her to sit IELTS first or to get IELTS as a nurse, but she can come into the UK on the senior carer route, which is what she's been offered, and then she'll have to still do the CBT, computer-based test, the NMC, etc. in the UK. The other 2 applicants that are shown here, they will both need to do the their IELTS in the UK again. And I don't think you can read it there, but there's the salary is shown as 27,070 for 48 hours a week. So it's real, ladies and gentlemen. You can earn very, very good money. Think of what you're earning now. Let's say you're earning, I don't know, 2,500 a month for the sake of argument here. So you're earning about 30,000 ringgits a year. Well, imagine if you're earning 150,000 ringgits a year, because that's what you're going to be earning. Yes, the cost of living is higher. Yes, there are other expenses involved. And yes, it may not be as simple to come to the UK as it is perhaps to come here. But at the end of the day, the opportunity is open to you, and that opportunity is for you to decide to take or not. So, last point is thank you for viewing this presentation, and I wish all of you every success for your future, whatever choice you make, whether it's to come with us or not. But I hope you found this informative and helpful. We don't expect you to remember everything, but we hope it's given you a flavor of what's available and what can be done. Okay, so that's what we are wanting to do and hope to be able to do for you. And as you'll see there is the BA HealthCare website. Also, we've already said to send to Eve. That's the WhatsApp number. And if you want to send it to Eve directly, she's an admin at ba-healthcare.org. So make a note of those questions. So thank you very much. I know some of you are unmuting already. Please stay muted for the moment. And I will now go to take your questions and see where we go from there. So thank you. So here we go. Let's go to the questions. Okay. I want to just get, I'm leaving this up at the moment. But I really want to get rid of the sharing. Okay.
Sir, please.
So, hi everybody.
Thank you, sir, for your presentation.
Let me try and take your questions as I see it. Brenda, do you have a question?
Yes, sir. No, sir. Thank you.
You don't. Okay, great. I'm just looking at those please, if you can leave your microphone muted unless you have a question. Okay. Now I see Madel's put her hand up. Is it Madel here or him? No picture. Don't know. Madel. I've got. Well, I want to get rid of this sharing thing. Oh well. There we go. Is it Madel?
Yes.
Yes. What's your question?
I'm just asking in behalf of those who are actually one of the students of FEMA that were forced to go back here in Philippines. So we're just wanted to ask if what will be the scenario or what will be the situation for us if we do avail this opportunity. So can we actually process our papers while we're still in the Philippines?
No, not at the moment. Sorry. Let me explain. I think most of you know that we have to get not only POEA approval, but we have a sister company, a partner company in the Philippines, and we are in the process of our UK company, which is not my Malaysian company, our UK company, getting accreditation with Polo in London. Until that is done, we won't be able to process anybody who is still in the Philippines. Not at the moment. You have to be not just outside the Philippines, but you have to have, I'm glad this has come up, I need to mention this again, and that is you must have at least 6 months left on your employment pass, that's your work permit or visa here, in order to make that application. So please remember that, guys. This is enough for another conversation, but it means you have to have that because the UK doesn't say you can't apply, but will make you go back to the Philippines to make your application if you have less than 6 months left when you make the application. Okay, that's not from now, it's from when we make the application for you. And right now, as you may have seen and heard, we cannot send nurses or senior carers, healthcare workers to the UK or anywhere for that matter from the Philippines. The advice we've received is to continue with our accreditation, get that all done, so that once the this situation, this temporary suspension is lifted, we could then process people directly from the Philippines, and that will be done through our partner company, which I won't go into at the moment because we're still signing agreements, etc. But the point is that they will process for you. It will also allow those of you who cannot extend your work permits for whatever reason. Sorry, can you mute your mute your
No, it's not counting.
I can hear you. I can hear you. Somebody
I
read me.
text to AT, sir, how to do that, sir.
Yeah, well, can you just wait? I'm still
yes, sir.
answering
Your
the
bank account, sir.
question. Please just
Your
wait.
bank account.
Mardell, just
sir,
getting that.
money and use your bank account.
Sorry, could you please mute your microphone? One person talking only.
The bank.
Sorry,
not the house.
Redme, please mute. I think it's you. Please mute it. So you will in the future be able to do this.
Go for me is online, is it?
Your family have paying amount.
Can you please mute? Do I have to shout? Please listen. Sorry, everybody else. Can you please mute? Redme, note 10.
There are many ways to pay. You don't need to use that.
What can I do, guys? Help me.
Asking you whether your family has bank or not.
Yeah, thank you. Please mute. Thank you very much. Sorry, really hard to speak over you. You still not muted your. You still have not muted your microphone, Redme. Redme note 10. That's what it says.
The boss is this one. Like this.
Sir, you can mute him.
I'm trying to.
You can mute her.
Oh, yes,
I am. I'm trying to do it. It's
not
not working. I have. Last, I managed to mute her. Sorry. I think the Redmi Note is the name of her phone. Okay, so Madel, if I get this right, what I'm saying is, in the future you can do this, but it's not a matter for all of you to know. You can't just say leave the Philippines let's say on holiday, which you can't at the moment in any case, and try and process this from another country, because you need to show that you've still got 6 months left on your work permit in order to do that. Okay? So, Madel, does that answer your question?
Yes, sir. I totally appreciate your answer. Thank you for that.
Not at all. By the way, your English is 6 to 6.5 at least.
Thank you for that, sir.
Okay. I can tell you that I need to speak to somebody for 20 seconds, and I can almost certainly tell you what your IELTS level is. So there you go. And I've been right so far, haven't I? Yeah, I've been right so far. With Frida, I said she'd be between 6 and 6.5. Guess what? 6.5. So I'm pretty good at this, guys. All right, I've got Jamel. Jamel Genon.
Yes, sir. Good afternoon.
Good afternoon.
Okay, I just want to double check if, because we're working here as a senior carer here in Malaysia as a caregiver, but one thing is there, our visa is not under in our employer. It's different. So like, because the Malaysian government didn't open like an open job offer for caregiver, so we use different visa. So is it, there is no issue in that if we go to UK, then the immigration will not check on that, or how is it?
They will, Jamel. And sadly, I can't answer that question. And the reason I can't answer that question at the moment is until we actually start processing. Remember, it's been 13 years since we're last able to process somebody. And, you know, I've got a lot of people who are under all sorts of different types of work permits. What we have to do is we have to make that explanation in the notes. And my belief, and I hope I'm not proved wrong here, but my belief is that UKVI stroke the entry clearance officers will recognize that, because what we'll be putting with it is your references and your other information. But do you remember I mentioned that you're almost certainly going to be called in for an interview with the entry clearance officer? That's when you have to be prepared for that, because you're absolutely right. They're going to say, I'm smiling when I say this, Jamel, they're going to say, you've got a domestic worker, a domestic helper's work permit. And yet you're saying you're a senior carer.
Yes,
so
yes.
Have you been lying to somebody? Now, you know, for everybody here, I can't answer the question. And you can't ring up the embassy and say, look, I've got somebody on a domestic worker, visa, work permit here. I haven't got that. Now, if in the future, I'll say this to all of you, my belief is that if in the future this was to become an issue, as I say, until we start the process, we won't know. It's just one of those things that, you know, with any immigration, they will never tell you what you need to know. They just never will. But what I'm very hopeful of is that the suspension, the temporary suspension of the Philippines will be lifted. So what would happen is this, and this is for all of you from another country who are working overseas, like most of you are, what would happen under those circumstances, we would apply for your work permit, you would have your work permit issued, because it's issued in the UK, nothing to do with here. Okay, they're not looking at your visa. They're not looking at that yet. They'll be looking from the UK, get your work permit issued, and then if necessary, it may be that you would have to go back to the UK, back to, say, the Philippines, and make the application in the Philippines through our sister company there. But the good thing will be is that if we've already had this accredited, which we will do, that it won't matter. It's just a processing. So you're going home, have a holiday, see your family. I know that's expensive for all of you because most of you don't want to go back home because how much money, presents and everything else you're going to take back with you. I know that one as well. But the fact is that will be the backup plan. Okay? You know, I'm sorry I can't be any more, clearer on this point, but I think you need to understand, in a way, we're the pioneers again. We were before. Going back to 2001, we were very much a pioneering company then. And you have to understand that there'll be a view taken by the entry clearance officers. However, one of the important points is there's this desperate need for healthcare workers in the UK. So if your resume is stating what you've done, what your work is, your references support that, etc., we are very hopeful that because the employer has already selected you, for example, that the ECOs here will not be too strict because you're under the shortage occupation list. We really need you to come to the UK. And we believe that the fact that they have reduced to 3 weeks, only 3 weeks to process your visa. Normally it's 8 to 10 weeks, but for healthcare workers only for healthcare workers, it's 3 weeks. So we believe that they are going to be extremely tolerant of that situation. And it's probably important to note for all of you, because you may be feeling, whoa, what's that all about? You know, you've got to think of it this way. You could be here on a dependent visa. Okay, just hear me out. You could be here on a dependent visa. It could be say your wife who's working. You can't work on a dependent visa, but you could still be a qualified nurse or senior carer. And technically, you might have just come from the Philippines 3 or 4 months ago. So the important point here, and I hope you all understand this, is actually not what you do so much as the length on your the length of your visa, because you will have had to provide. This is why now can you understand why I'm so strict on producing the certification? Because if your certificate and your work permit says this is what I've been, you know, your local employment pass here says, doesn't necessarily, sorry, your references and your certification says this is what you've been doing, you're being judged on that. The fact, the only real point that the employer should be, sorry, the UKVI and entry clearance officers should be looking at for you is, do you need to go back to the Philippines to make the application, or are you allowed to make it from here? And remember I said checking boxes, ticking boxes? See, that'll be one of the boxes is how long has the visa got to run, dependent visa, employment pass, whatever. And it will say 7 months, 6 months, 8 months, whatever. That, in my mind, is all that they should have to do to determine that you can go abroad. Why? Because the decision to employ you and to issue the work permit has already been made. It's been made in the UK. Now we're talking about the physical need to get your visa, your work permit in your passport, which has to be done here. In fact, for those who don't know it, what happens is your work permit is sent back. Sorry, not your work permit, your visa, everything, your application is sent back to the Philippines. It's not processed here. So you know, it's sort of interesting dilemma in a way, because everything gets sent back to the Philippines, because that is the regional hub for Malaysia. Whether you are from the Philippines, whether you're from Indonesia, from Singapore, it all gets done in the Philippines. Okay. I know, rather long-winded explanation, but you know, please understand this is opened up in March. So what do? Sit here, we say twiddling our thumbs for the next 8 months, 10 months until somebody else does the trailblazing, and then there's no jobs left? Or do we concentrate on finding jobs now? And do remember, we were doing this for many, many years between 2001 and 2010. So at that stage, we were the largest provider of nurses and senior carers for the UK. So we know what we're doing. But that is the one question I cannot answer until you actually put them in. And that would apply, by the way, to any new status that applies. Until you put your first ones in, you don't know, but you have to ask questions. Or they'll come back, if they refuse it, they have to tell you why they're refusing. So we know what the refusal is. Okay? And then we can appeal it, hopefully. Right, sorry. Okay, thank you, Jamel. Does that answer your questions? Thumbs up's good enough?
Yes. Then,
Yeah.
sir, another thing, and I have another one more question.
Be quick.
Regarding for the IELTS.
Yeah.
Is it there is an, I think, how much is it? How many months is the expiration on that?
2 years.
There is 2 years. Oh,
2
okay.
years. Okay. So you've got 2 years, and it costs 895 ringgits here.
Okay.
And you
Okay.
just contact British Council directly. You pay it directly. You send us the receipt. You send us your receipt to show that you booked it and whatever, and we can go from there. Okay. Jamel,
Okay.
IELTS level again at least 6 to 6.5. I would hope you would actually get up to 7, but probably 6.5. Okay.
Thank you.
So there's
Thank you,
there's
sir.
a good chance for you. Okay. I'm not sure who else has got a question. I've got a Galaxy A30. Sorry. Yes. Where are you? Oh, right, you're there. Lenny. Okay. Yeah, I can see you waving. No, there's no job as a pharmaceutical. No job. No possibility. Why? Because it doesn't come under the shortage occupations. But what is good news for you is because you're Malaysian and your wife's Filipino, it doesn't matter. What happens is you apply to go there, okay, from here. You still need the IELTS and everything else, but the visa issue does not apply to either you or your wife. Your wife would then come as a dependent, not needing a work permit. She would come as a dependent with your son or daughter, okay? And then she could work full time because there's no restrictions on your dependent working full time. You get a family visa for her, okay? So you do not, your wife would not need a work permit, okay? Sorry, somebody else is talking over us. Sorry, I don't know who it is. Abby 75, I think. Okay, does that answer your question, Remy? They're all on you. So you better be good. Now, what am I going to judge your English at? Probably IELTS 6, maybe 6.5. Okay. Okay, not at all. Okay, thank you for your question. And I hope that helped anybody else thinking that way. Next one, I've got an Abby 75. No, I've got a Galaxy A30, but I don't know who the person is. You're waving. Whoever's waving, you unmuted. Okay, who are you? What's your name?
I'm Lilibet Bilya, sir, from Philippines.
Okay.
I'm recently working here in Malaysia. So I just want to ask if really necessary. So my working permit is expired already, but because of the pandemic, we can't able to renew it.
Understood. Yep, understood.
So, is it really necessary to renew it before applying to you?
Okay, who'd like to answer that question? Yes, I'm going to be very English. Yes, it bloody is. You know why? Because you've got to have at least 6 months left on that work permit, okay? Remember that. That is a critical, other than IELTS, that's the other critical thing that you have to consider. So we've got a few other people like you. You need to renew it or get a new one from somewhere. And that will be better in a way because you'll have a much longer period. As long as you're renewing, you see, I'll repeat this one more time. It will not stop you applying. It does, it makes it impossible for you to apply from here.
Okay,
It means
okay,
that
okay.
you have to go back for your
Because-
visa. You have to go back to the Philippines.
Okay, okay, sir. Because we, as far as you know, we are working here under the visa of domestic helper or a household
know.
worker. So,
I
but we
know.
have option if we really want to, we can apply on service sector and domestic helper. So, which one you prefer for it?
Oh, I don't want to make any suggestion in case I'm wrong.
So it's either service sector or domestic helper. It will be okay.
I would suggest that service sector probably, and I don't think it matters too much, but you know, we go back to the question that was asked by Madel. We're back to this whole thing about the application.
There's no caregiver visa here in Malaysia.
We know that. We know that. We have to explain that. We have to explain that. But what I'm trying to say is whether you go as a domestic worker, visa, or whatever, the most important thing is the period of time that you have on that visa. Your certification, what your actual job is, what you're currently doing, that's another matter. I'm pretty certain, but we'll make sure they know, that there was no category for a caregiver in Malaysia. They just don't have it. And therefore, if you want a caregiver, you have to use a domestic worker or what's the other one? Service sector worker, yeah.
Yes.
So I mean, we're going to explain that, but we will be explaining that. But as I said, the only thing I'm always very transparent. I don't want anybody to get the wrong idea. We just don't know.
Okay.
You know, until we begin making the applications, we don't know. But then, if necessary, we would go back and say, yes, the reason being he's got a domestic, workers visa is there is no category for a caregiver.
Okay, sir.
And what I would be doing in any case is I would make sure that on your application, your visa application, there is an area for additional comments. You would put that in there.
Okay, sir.
Or you get if your person who's issued that is happy to support you still, they would write a letter stating that we've employed you as a caregiver on this level. However, we were unable, the only category we could use would be domestic worker. But look, that is a question for nearer the time, because I realize a lot will depend who your employer is, how close you are with them, whether you have your own flexible, work permit. I know quite a few of you have your own work permits, which you've got yourself. It's not tied to any particular person necessarily, but you've got your own one. But that's more of a detailed question. On a general, I can answer it on a general basis. We'll have to see as we develop, and each person may be very different. So how we apply to each person is different. That's why you're so lucky, because you have me around here. Because when you've actually made 7,500 applications, you have a bit of an idea of what they're looking for. And if you're British, you also understand the British way. Okay, not guaranteed, but it's a lot better than you try and do it yourself. Okay, thank you. Thank you very much. Okay, I've now got something come out. Right, I then got Lisa. Lisa, can you put your hand down? Yeah. Yes. Yes.
Sir, I just want to ask, because after we provide all the documents in case later on, like we pass all the IELTS and everything, is there any processing fee for the work, processing for the job of our work permit like this, sir? Are we gonna pay, or the employer will gonna provide everything later on?
Okay, Lisa, did you listen to the whole? Were you able to listen to the whole presentation, or did you come in late?
Sorry, sir, because like a while ago my internet is not that so good, so I didn't hear. It's buffering, so I didn't hear.
I'll just try and give you a quick answer, but I'm sure Celia or whatever can help you if you need to. We'll speak later. Look, there are no direct fees. There's no cash out. None of these things that you're so used to having to pay to other people. There's not that. There's a surety bond once you've got your IELTS, £200, which is refundable in the UK, and there's £300 when you get a job offer, which is 10% of the immigration skills charge. And we've been through all of this. You may not have heard it. So that's the only charge. It's not a charge though, it's a bond. You understand the difference because you get the money back. But if you decide, change your mind and decide you're not going, then you lose that money, okay? As for the processing itself, there will be a process that there is your visa fee of £232. You will pay that initially. You will pay that. That's about 1,400 ringgit. You will pay that initially, but you will get that back from your employer in the UK. Okay?
Okay, sir.
So, but we don't have any other, processing fees or costs or anything hidden under the table or hidden under anywhere else for that matter.
Because, sir, like there's another, like I'm applying also like in some emails online like this. Someone is sending me emails to work UK, Canada, Australia, but because they asking me to pay first like this, that's why I'm asking you, sir, about this thing.
I understand, and I'm smiling when I'm answering your question because we're too, very British again, we're too bloody fair. We don't charge you. We do all this work for nothing. It's hours, giving up my Sunday to talk to all of you. We do all that for free. We get paid only when you get to the UK. We only get paid when you successfully get there. So I hope you understand there is no benefit in me suggesting to anybody that they go through this process if I don't think you have every chance of getting there. But going back to Madel's question, that one question which I cannot answer to anybody, and I'm sure, excuse me, I'm sure Leo understands what I'm saying and why I'm saying it, is this question of when we actually make the final application. Because entry clearance officers are a law unto themselves. That's what we used to say, a law unto themselves. They have the power of approving or not approving visas. But what they won't be doing is they won't be approving or disapproving your job because you already have received a work permit in the UK before you make an application for a visa. So you know that you've got the job. It's just getting through the final part. And remember, the ECOs are looking for people who are literally have no intention of working as a senior carer or a nurse or anything else, and are just looking for a method, a way of getting to the UK and running away. And sadly, that happens. We can't. Well, I have one girl who really only wanted to get there because she had an English boyfriend. There you go. And so lots of lies and everything else. She got to the UK and she ran away. We then just cancelled her. We cancelled her work permit, but that wasn't the point. The point was it caused a lot of upset. Our reputation was slightly affected by that. In fact, that employer would never employ another Filipino again, just because of that one instance. So you have consequences. You make decisions, you have consequences. But as long as you're genuinely going there to work at the job that we've asked you to do and that you've accepted, and you complete your 3-year contract, there won't be any issues at all. Okay?
Thank you,
all right,
sir.
thank you. Thank you, Lisa.
I'm really
okay.
interested on this.
Okay, great. Purple Unicorn, you've got a hand up, but no face.
No.
Okay, Purple Unicorn, you've been good enough to keep sending messages to mute your phones to people. Mute your microphone. Have you got a question? Because you've got your hand up.
That's all, sir.
It's okay?
Yes, sir. Thank you.
Okay. What about, as I say, Purple Unicorn? I don't know who Purple Unicorn is. I can see you. I'm waving at you. You've got your glasses on. Yes. See you. Have you got a question? You need to unmute. Yeah, you need to unmute your. Yeah, okay, you're
Yes,
live.
yeah, there. Good. Yeah, all right. So I have a question regarding changing occupations. So a lot of us no, a lot of us do not have actually caregiver experience. Like I don't have. So I'm studying in FEMA to be one.
Yes,
Um
understood.
so but I have some IT, I'm from IT, and then I do manage some people. So how do we like do you have some suggestions on how to I know you said a while ago that we need to frame our resume in terms of healthcare, but any suggestions to, I mean, besides telling, yeah,
Look,
I know it's hard.
I have to be very careful in what I say. Okay,
yeah,
you need to understand that. I have to be very careful. First of all, you must complete your FEMA course. Secondly, I would hope that you're getting work experience, which I know you get as part of the course. Thirdly, the best advice I can possibly give you is, if possible, try and get some volunteer care work, caring, support work, whatever. You know, a lot of this comes down to how serious you are about coming to the UK. You know, how, and I'm not, it's what we call a rhetorical question. I'm not asking for an answer. I'm just, you know what the word rhetorical is?
Yes, I do.
Good.
Rhetorical, like a pretend question, pretend answer, like
absolutely. That's fine. That's fine. So, you know, what you have to think about is, if you're really that serious, you will do whatever you need to do to achieve what needs to be done. You see, I'm not worried. I'm going to repeat this one more time. I'm not worried about your ability with the employer. I'm really not worried about that. Having gone through all of the different, listened and recorded every single interview we've gone through, the employer made it absolutely, this particular employer in any case, made it clear that they're going to teach you from the ground up. And honestly, that's going to be the same with every single employer in the UK. As I said earlier, even if you're a highly qualified nurse, you know, thank you, Leo. FEMA will give you a practicum OJT during our lesson. Yeah, thank you. So what I'm saying is, it's not the employer I worry about. It's UKVI, because UKVI, just as we have rules and regulations here, in the UK, they're much sterner, they're much stricter. So we have to make sure that we provide the supporting evidence that provides, from AJ, thank you. Oh, pleasure. You've got to leave off. Okay, I understand. So what is so important is that we have to, what I always say is, we plan for the worst and hope for the best. Okay? So this is really what we're up against and what we're trying to do. So we're trying to make sure that when we make that application, I just want you to focus on that for a moment, for all of you. I want you to imagine they've got their checklist with all the boxes, and we want them to be able to check, all the way down. So when they get to the bottom, they can go, sign off, done. If they don't do that, then if there's a box left open, that will be the issue. We've got to then answer that situation. So what I'm trying to do, where possible, we're trying to, in advance of any question being asked, we're trying to answer those questions so they don't have to ask them. Okay. Do you understand that?
Yes, I understand that.
Otherwise, I would feel really bad for the employers. And what I mean by that is, if I felt I was putting people, frankly, like yourself, forward, who has got very limited experience and everything else, if that was to happen, then I would feel pretty bad. But the reality is, I know they're going to teach you. And the key thing for them, for the employer, is your English. And if you think about it, it's logical. You see, if you speak really good English and understand English, and you understand words like rhetorical, and I think a lot of you were scratching your head thinking, what the heck do you mean by rhetorical? Then it's much easier for them to teach you, to make sure you improve quicker. And why I've said your other background, your other life still has a meaning. They can look at you and say, well, this is somebody who's had 10 years experience, for example, in IT or whatever it might be. They've actually been a team leader, or they've managed a section or something. That's why that's important, because that gives a justification as to why you should be a senior carer, because you're not allowed to go to the UK as a carer. You're not allowed to do that, because the UK VI, UK Visa and Immigration, will not allow that. So that's why we have to create, but honestly create, the right picture.
Yes. Yep. All right. Yeah, of course, honestly create. So yeah, I would, yeah, on the volunteer thing that you suggested. Yeah, I took note of that. Yeah.
Okay,
Yeah,
and your
that's all.
IELTS, I forgot to mention the others. Yours is 6.5 to 7 on speaking. In fact, I'd expect you to get 7.5 on speaking.
Oh, okay. That's great to know.
But I don't know what you're writing tonight, so we'll have to see. Okay.
Oh yeah. Yeah. All right. Yeah. Thank
and
you.
Both the other two, thanks a lot. The other two I didn't mention. Sorry about that, but you know you were fine. Probably IELTS 6. So there you go. So you know overall. Okay, I've got a lot of questions still coming up, and we've still got 64 participants. So can we put your hand down now, if you don't mind? And then we've got the next person. Who's the next one? Malu. Malu, you have a question? Malu, do you have a question?
Yeah.
Yeah, go ahead.
Good afternoon, sir. Good afternoon to everyone. Mine is just, it's not actually a question. It's just a confirmation, because I've been hearing the informations that you just disseminate just now, and then I would just like to ask to confirm if, say, the process is half done here in Malaysia, and then I have to go back to the Philippines, emergency situation, something like that. For example, only that won't affect the process. That won't affect the process of application, right?
No, Malu, just keep it really simple. Just look at what's on your whatever's on your work permit. It's how many months you've got left. If by going back to the Philippines, for example, it was possible for you to make the application from there, not make the application's been made, but you then had to go back to the Philippines and the suspension's been lifted, it would be easier in a way at that time only to make the actual application, the visa application itself from the Philippines, because you wouldn't have to have more than 6 months left on your visa, etc., if you see what I mean. But otherwise, I mean, look, for all of you, this is not going to be a quick process. You don't think that you're going to be in the UK next week or next month or even in 3 months' time. This is likely to take at least a minimum, if you've got IELTS, of 3 months, probably more like 5 or 6 months. And if you don't actually have your IELTS, it obviously takes longer, because everything starts effectively from when you get IELTS. So if you had to go back and come back again, it's not a problem, but you'd have to make sure that your visa here was still, your employment pass was still current and still had more than 6 months when you apply. And I have to keep stressing when you apply, because it's not when, not from now. Because if you make the application in 3 months' time, you'll only have 3 months left on your employment pass. And this is just the rules they have. You see, and this is the irony of the whole situation, is that no one's going to stop you making the application. It's just that you're just not, that they won't accept the application if you've got less than 6 months from here in Malaysia. You just have to go back to your own country. And that applies to everybody. Okay? Does that answer the question? Yeah, good. Okay. Raquel. Oh, by the way, 6, I think 6, bordering on 6.5 for speaking. Okay, Raquel. Yes.
Hello, sir. Good afternoon.
Hi. Yes, good afternoon.
Sir, I did not yet enroll yet at PIMA courses, but I do finish my nursing aid courses from Singapore, and I also have a certificate and license for CPR and AED. Do I still need to finish the course from PIMA?
Not necessarily. What you need to do is complete and send me a resume. We need to see the resume so that I can judge whether what you have is better than or similar to what FEMA. Now, how long was your nursing aid course in Singapore?
8 months, sir.
8 months.
Yes,
But
sir.
you can be honest with me, but would I be right in saying it's just one Sunday a week?
Yes, sir.
Yeah, that's right. I say you can be honest with me because I know.
Yes,
We had an office. I used to have an office in Singapore, so I know that.
yes, yes. I have the complete certificate of from Singapore, sir.
Well, you know, luckily for us, they don't usually ask the question, how long was the course? In other words, how many days a week did you go? How many hours did you study for? Otherwise, we would be in trouble. The important thing is you have a certificate. You have your transcript of record.
Yes, sir. I have.
Yeah. So
Yes, sir.
that's what we need to see, plus everything else you've got, which you've mentioned to me.
Okay, sir.
You should be. Was that quite recently? Was that quite recently?
2019, sir.
2019. That's fine. That's within a couple of years. Normally, within 3 years, it's okay. The problem is if it was in 2015, they might say you know it's been 6 years since you did anything, etc., etc.
Okay.
Do you follow me? And are you working in that same area here in Malaysia? In
Sir,
healthcare?
currently, no, sir. I'm as a nanny, sir.
A nanny, okay. But you know, I don't want to say too much, but you know, you use your past experience, and being a nanny is you know, you're looking after a child, you're looking after family, maybe there's some elderly relatives in the place.
Yes,
that
sir.
You know, be inventive. Don't be untruthful, but be inventive. Remember, and I keep repeating this, this is not for the benefit of the employer. This is for the benefit of the UKVI. And I would never, ever want you to put anything down that's an outright lie. But why I said earlier about focusing on the areas which are in healthcare, for example, is because they don't want to hear about, you know, your other jobs of what you've done. What they want to make sure of is that you are capable. And remember what I keep saying about checking the boxes, ticking the boxes. Yes. So they want to make sure that you're able to check that box. And for that reason, verbally what you've told me is fine. That's fine. But you have to say, you know, you just have to send in your resume and make sure, this goes to all of you. Now you've heard me talk about this, make sure you focus on giving as much information as possible on areas such as healthcare. Okay? Okay, bye, Malu. So you go. I saw somebody else said, is there an age limit? You must have come in very late. No, no age limit. Okay, so if that answers your question, you can probably put your hand down again, because there is no age limit for going to the UK, but you have to be fit and healthy. Okay? Moving on, I've got Eunice. Eunice, do you have a question?
Yeah,
And
hello,
next will be Sally. Yeah, yes,
Can you hear
Eunice.
me now? Yeah,
I
I'm
can.
Eunice from Philippines. Currently, I'm working here in Malaysia. Sir, first of all, I want you to know that after I heard this meeting, it triggers my self-motivation. So I'm thinking about my future already. So my question is, some of us still in the process of learning in caregiving under FEMA, and it takes really time to accomplish. Now, is it really necessary for us to take the IELTS exam that soon while we're still having our class?
No.
Okay.
The honest answer is no. But the important thing is, if I use this expression, forearmed is forewarned. Okay? So if I'm you and you're motivated by this and you want to go forward, and this applies to everybody else, doesn't it make sense to start researching and reviewing for English now? I'm not saying you have to sign up. I'm not saying you definitely don't want to you know, if you're needing to get your certification, it's no point actually doing anything until you've done that. But we don't expect this to be here just for a few weeks or a few months. I expect this to be around for years. And, you know, and we can't place all of you. I mean, right this moment, if all of you had IELTS at the right level, I couldn't place all of you right now. I don't have enough jobs, because part of the problem is managing expectation. And what I can't afford to do, because I can get a lot of jobs, that's not a problem, because of my background, because of my relationship with Care England, that's not the issue. The issue is that once I alert my clients, and my old clients especially, I mean, we had the latest order we got, he took Filipinos from me in 2005. He took Filipino senior carers from me in 2005. He's just wanted 2 more nurses right now as senior carers. So we're talking about 16 years ago. And he's part of Care England. And as a result of that, sorry, somebody's talking in the background. Sorry, please. Thank you. I think it must be you, Rosalind, because you've got your hand over your mouth now. So it must be you. You must be guilty. So if you understand what I'm saying, Eunice, obviously it wouldn't make sense for you to actually take the exam now. But what would make sense is to, if you're taking this really seriously, is to build into your busy day. I know you may only have 1 day off a week, and already you're going to FEMA probably that day, but to allocate online, there's a lot of test material, a lot of ways for free that you can practice English. And if I was honest with any of you, and this is really old-fashioned, guys, but what I would say to you is read a book.
I do a lot of books, sir, here in my room.
Well, that's it then. So reading English books, I can see your pile of books there, right? Reading English books will just help your vocabulary. It will just help to expand it. And then write. I mean, this is really old-fashioned, not on your computer, but write English down. Write a letter to yourself. Write a letter to a friend. Write a note to yourself. You know, all I'm saying is you need to get the little grey cells up here. Mine are pretty well run out now at my age, but you know, get these grey cells working to get you into the right frame of mind for taking the exam. That's why I say forearmed is forewarned. Forearmed means you can begin practicing now, and then maybe in 6 months' time, you then, I don't know what stage you're at, but whatever stage you're at, then you go ahead and book the IELTS. And as I said, do it through British Council, because the road to IELTS is really helpful. It's really good, and it will help you a lot. You know, if you get to that stage. Does that answer your question?
Correct me if I'm wrong, sir, because I thought that taking exam to IELTS is one of your requirements, something like that. So I just kept wondering, I'm still in this process of learning, then I will take the exam soon. So I didn't understand, so sorry about that.
No, that's fine. I mean, look, 80% of you probably are not in a position at the moment to take your IELTS. And even if you are in a position to take your IELTS, it might be premature. It might be too early to take it. So it's those of you, what will happen is, why I want you to do the English test is, at the moment, I'm looking at those who get 16 or above out of 20, because I feel confident, even with my small English test, I will know from that whether you have a very good chance of getting at least IELTS 6. Then I can at least say to you, yes, I reckon you can book your IELTS test, but for goodness sake, don't just book it and forget it, book it and also do the reviewing at the same time, because you get a lot of help. Okay? But, so what we want at this stage is your resume and building up our database, and then we will, working with Celio, for example, we try and get enough information in order to make sure that when you're ready, and I'm sure you will, you'll advise us, because the important point, contact point for us, is when we get an email or a text from you, WhatsApp saying, I booked my exam for the 8th of July, for example, and here's my booking confirmation and proof I paid. And think about it, we now know you're really serious because you're not going to pay 895 ringgits, which is probably half a month's salary, just to go ahead and learn IELTS or take the IELTS exam, unless you're serious about coming to the UK. But similarly, I don't want to recommend to anybody that they take, you see, if I've got somebody who gets 5 out of 20, there is no way that person should be taking IELTS at this stage. Because I will tell them now that they will get probably 4.5, maybe a bit more, maybe 5, 5.5. And that won't be high enough. The questions we're giving you are based on IELTS 6 to 6.5. Okay? So I know the answers you're giving are those that would fit that criteria, that level. And that's why I'm saying there's often not just one answer. Quite often there are many answers, and it will depend on your level of English, just how good your English is, as to whether you will get a higher score or a lower score. Okay? Does that make sense, Eunice?
It is.
Good. Okay, good for you. Okay, thank you very much, Eunice. You can put your hand down now.
Okay.
Okay. No, Remy, you've got to wait for me to ask you. No, I'm just joking. Sorry, Sally, wait a second. Sally, where have you gone? No, you're there still. Sally, do you mind waiting for a second?
Yes, sir. Yeah, sorry. I'm sorry. Good
Okay,
afternoon.
wait a second, Sally. Remy, go on then, go back in. I'm very strict. Okay. Look, Remy, I'll be honest with you. You wouldn't have the time or the ability or the availability to do medicine. You know, it's very hard to get a place on the course in the UK in any case. It's about £150,000, £150,000 from memory. You know, it's a 7-year course or 6-year course. I'm not trying to put you off, but it's something, to my way of thinking, it's a full-time career change. You'd have to make that decision. Now, what I would say to you, Remy, is something totally different. I say, you come across as a senior carer, you aim to get permanent leave to remain in the UK, which you can achieve within 5 years. So you work for 5 years, you and your wife, you build up some money, and then if you can afford it, maybe you can take a loan out or whatever, then you can potentially look at going into doing medicine. And you can apply maybe 3 or 4 years beforehand. But have you looked into what the requirements are in terms of your underlying qualifications are? I don't want to get into this now, but have you looked at that? Because whether you have or haven't, you need to look at what the minimum requirements are in order to be able to join a course in the UK. But why do a lot of people go to Russia and other countries to do medicine? It's because it's too expensive in the UK and very difficult to get a place. However, what I am saying to you, fast forward 5 or 6 years, you've got experience, you've been working, you've got some income, you and your wife are both now potentially British citizens. Now you apply. Because you'll get the course rate at the UK price, not the overseas price. Okay? Yes, effectively, after 5 years, you will be entitled to apply for permanent leave to remain. Initially, it might be indefinite leave to remain. You may have to wait another 5 years. I'm just saying that because there are two different strategies. But usually, within a year or so, you would be capable of getting, first of all, indefinite leave to remain. And then what I would, well, it's entirely up to you, but I would definitely suggest this for your wife, and that is to get your British passport. Sorry to be, I know, because my wife and I have been discussing for some time now, the need to go back to the UK to get her British passport. She's had a visa for years, but she needs a British passport. But the difficulty is, Remy, I have got to go back to the UK as well. My wife's waving at me. Hi, wave. Her name's not Sugar, though. That's Maria. But the reality is, it's like a complete change. So I would have to literally go back to the UK to live with my wife for her to get permanent leave to remain. They let you come in and out a bit, but not very much. Okay, Remy, I've got to move on to Sally now. I hope that answers your question. Not at all. Sally, come on, you've waited very patiently. What's your question?
Yes, sir. Good afternoon. Yeah, sir, I just want to ask, what was the passing rate of the English exam in case? Then the second
16 out
question
of
is,
20. Well, what I do is this. I look at looking at initially right this moment. I'm prioritizing those that get 16 out of 20. You might get 12 out of 20. It doesn't stop you, and it's a private exam which has no value to anybody but me. Okay, Madel, thank you.
I got 3 questions, sir. So I read it all my question, then shortly can finish. Thank you.
You'll start for 3. Go ahead.
In case we get the exam, English language exam, is it recital or in recitation? And the third question, if an applicant only high school graduate, is there any possibility can get employed to UK? That's all.
Okay, let's answer your question. Let's start with your last one. Sally, I tell you now, you have to do some reviewing on your English. Your English is only 5 to 5, well, probably 5.5 at the moment. Okay. Now, don't listen. Don't be disheartened by that. That's really important. Don't be disheartened. You see, it's your background tells me a lot. The fact you're high school and you haven't gone to university, for example, or college, is almost certainly one of the reasons why your English is probably not so strong, because it's the grammar and it's that repetition of being taught in English. You can overcome all of that by reviewing for English. It's only practice. So watch English films. I speak to my own family often about not speaking Tagalog or Ilocano at home. First of all, I get fed up with it because I can't join in the conversation, because I don't speak enough of it to be able to join in enough. Diba? So that's the first thing that I find. And secondly, it's not helping them to improve their English. It's uncomfortable for many of you to spend the time talking English all the time. And again, I'm sure, and correct me if I'm wrong, Remy, just put your hand up if I'm wrong, or thumbs up if I'm right. You and your wife speak English most of the time, correct? Would I be right in saying you speak English, you and your wife, most of the time? Or do you speak Malay? English or Malay? English?
Sometimes Malay and English.
Sometimes Malay and English. Malaysh. Sorry. Anyhow, it doesn't matter. Singlish, Singapore English. Anyhow, yeah, no, I mean, why am I asking, what I'm asking, bye-bye, Eunice. I see you're saying goodbye. Why I'm asking that is that, because one's Malaysian, one's Filipino, what you don't do is you don't speak Tagalog together, other than perhaps the odd word. So the more you can push yourselves to speak in English, the better your chances are of getting a higher score in English. So Sally, from your point of view, there is certainly nothing wrong with a high school education. Look, I left school a long, long time ago, 1974, long before you were born, but I left school with 9 O-levels, GCSEs. They're now, whatever they are, IGCSEs now. I never did A-levels, I never went to university. And yet I built up and ran multi-million-pound businesses. I've employed thousands of people over the years. And I say that not to be boastful at all, but just to say you don't need to have a university degree in order to do very well. That is not necessary. But I've got to be honest with you as well. Back in the 70s and 60s, you only went to university if you were English. If you wanted to be a lawyer, a doctor, a dentist, you know, a vet, or you wanted to go into teaching. Because for any other job, you didn't need to have a degree. And that's what it was like in the UK. Within 5 years of me leaving school, it would have been necessary for me to have at least A levels in order to have done the job I did at that stage. So things move on. What I'm trying to say to you is, don't worry about your high school, but you have got to be focused and you've got to take a serious view on being able to effectively get English. Because I'm telling you now, at this moment in time, I would not be confident in you getting more than maybe 5.5 or thereabouts. And I could be wrong, but I would say that in my tests that I've sent to you, I would expect you, as long as you don't cheat, you did it properly, to get between 8 out of 20 and 10 out of 20. Okay, that's what I'm suggesting. Now, I'm sorry if that sounds harsh, but you know, that's my job. I do not want to set you up to fail. And that's why I'm saying all of you have got a good opportunity, because if you feel that your English is weaker, and that's why by doing my test, it will give you an idea. It's not science, it's not 100%, but it will give you a pretty good idea as to what your level of English is. And that's why I'm saying cheating doesn't help. It really doesn't help at all, because it gives an incorrect view on your English. Okay, so I hope that helps you, Sally. Your other two questions, can you remind me what they were again? About in station and out station or whatever. What was it? You asked the other two parts of the question. I can see Melly's got a hand up. Can you remember what the question was, Melly? Sorry. Are you answering her question, or are you asking your own question?
Yes, sir. Good afternoon, sir. I'm work here in Malaysia as a helper.
Sorry, Melly, could you hang on a moment? I wasn't sure if you were answering a question for Sally. Hang on a second, I'll come back to you. Okay, Sally, are you okay?
Yes, sir, I'm okay.
Okay,
thank you.
Not at all. Good luck on that. Okay, Melly.
Thank you, sir. Good night.
Not at all. Thank you. Melly, just so you know, in future, there's a button on your Zoom which says, do you want to put your hand up?
Good afternoon, sir.
You don't have to physically put your hand up, because I can't see everybody here. Yes,
in
Ben.
Malaysia as a helper, and then I enroll in PIMA as a caregiver. I just asking, sir, if we are finish our course in PIMA and then we are getting the certificate, there's be possible to qualify for UK caregiver?
Well, I hope so. Otherwise, I've got a lot of people from FEMA who are wasting their time. Yes, of course there is. That's why Leo is helping and pushing forward and proposing people. So yes. But again, Melly, I'll use this time to practice your English. Your English, again, is at about 5.5. You need to get that up to an overall of 6. And that's going to take a bit of practice, okay? Again, I'm not being mean. I'm just being honest with you, because I don't want to waste, but you've got the time to do it. So if you're committed, age isn't a problem. I know you're only 21, but age is not a problem. You know, that's not going to be an issue. So it's just a matter of making sure that when you take your English test, you are, you know, confident and able to get it. Okay?
Okay, sir. Thank you, sir.
Thank you. I'm just looking at lots of people here. Sorry. Now, has anybody else got a question they'd like to ask? Anybody else? I'm just flicking from page to page. Anybody else? Anybody else? If you do, could you please put the hands up on on the on your Zoom, and I'll find you. Yeah, I've got two. I've got Daisy and Nemts. So Daisy, do you want to ask a question?
Yes, sir. Good afternoon.
Hi.
Yeah,
Lily.
so currently I am in Philippines, and as you've said earlier, it is really hard for us to apply for this opportunity, right?
Yeah.
So maybe in a couple of years, or maybe next year, if this pandemic is, not getting worse, and we have a chance to go to Malaysia. Is there any possibility that we can still apply for this opportunity even though that I was not working for a couple of years? I was working in Bangkok for a long years, like 4 years. So
What were you doing in Bangkok?
I used to work in the hospital as an international coordinator, and I
Okay.
worked in an Australian company as the nursing assistant.
Okay,
So,
nursing assistant. Well,
yeah.
the simple answer is almost certainly yes, not no, because of the pandemic.
Yeah.
But what I would be doing if I was you is, again, it comes back to how serious you are. I don't expect this situation to disappear for years to come. I'm expecting to be, I mean, we were sending 1,500 Filipinos a year to the UK. Just to give you an idea. As senior care, 70% was senior carers, 30% as nurses. So what sort of course have you done, Daisy? Very quickly, did you do a
Nursing
caregiving
assistant.
course or a nursing course or a...
I only work. I mean, I studied nursing assistant for 1 year in
Okay,
Philippines.
that's fine, because if you take that and your 4 years work experience, that would be
Yeah.
good. But as I said to one of the other ladies, what I would suggest is get some current experience, even at weekends or whatever. Effectively, what you want to do is make sure you're up to date with current practices. And bearing in mind, I do understand what it's like in the Philippines. Where are you from in the Philippines, Daisy?
I am in Mindanao, sir.
You're in Mindanao, so you're in the south. Okay. So Visaya.
Yes,
So
sir.
Visayan, you're speaking Visaya. Yeah, okay.
Yes, sir. Right.
So the truth is, from that point of view, you know, I know that the facilities are not very good, but anything you can do in helping, and think of it from your CV, your resume point of view, the more you can do that, the better, because what it allows you to do is say that, you know, you can see the picture I'm drawing, I hope, or painting, that during the pandemic, it was not possible to work, etc., etc., etc. However, in the last 6 months or the last year or whatever it might be, I have been undertaking volunteer nursing assistant work at you know, where it is. That goes on your CV. What I would be more concerned about is you continue to do nothing in that area for the next year, for example, and now it becomes 3 years since you last did anything. And now I'm more, in a way, I'm more concerned not with UKVI, but with the employer, because the employers will have a lot of people to choose from. And their choice might be somebody preferable who's got current up-to-date experience. Okay? That's all. So there's no yes or no, there's no right or wrong. And I would, you know, from everything I've heard, I'm expecting this temporary suspension to be lifted within the next weeks or months, few months at the longest. I might be wrong. Normally I am, but I might be wrong.
Maybe.
But it's not going to go on forever. So I would suggest that, you know, what you're doing is you continue practicing your English and you try and get some healthcare experience, doing what you were doing before. And think of it in terms of adding strength to your CV, to your resume. Okay?
Okay, sir. One more question, sir. Because I've seen earlier that one of the requirements is transcript of records. will it affect the application in the future? Like I in my transcript of records, like it didn't reach to 72 units. Like I've noticed to some other countries they comply 72 units for the applicants.
I'm sorry, I didn't. It's not your voice. The sound wasn't that clear, or maybe I'm deaf. I didn't quite. Could you speak up a bit and repeat it? Shout it at me.
Sorry. Yeah. So because earlier I've seen one of the requirements was the transcript of records. So will
Yes.
it affect the application if the units from the transcript of records didn't reach the 72 units? Because
No, it
from the
won't.
other country, I know like I've tried before Canada when I was in Bangkok, but it's because they needed someone to have 72 units from the transcript, so I was not able to continue for the application.
Again, like everything, we have to see the information you've got. But from as far as I'm concerned, as long as you can demonstrate that you've got certification, that they're not looking for how many units you've got or whatever. They just want to know that you've got that experience. The people looking at this from the entry clearance officer, from the point of view of the government, generally aren't experienced. They're just general people. They're not medical people. So they're just. You remember what I kept saying about checking boxes, ticking boxes. You know, the important thing is that you've got a certificate there, that you've got a transcript of record, that you've got a resume that says you've got 4, 5, 6 years worth of experience. But which is another reason why, again, I said, bye, Nelly. Sorry, she's going on. Why I said it would make a lot of sense for you to get some current, updated information, but to put on your resume that, and I don't want to put words in your mouth as such, but that you were looking after your family during the pandemic, were unable to work, but since that's easing off a bit, you're now doing voluntary work at such and such a place and have done, and this is the duties you've been doing, so that it shows that you're still currently involved. Okay?
Okay, that answers my question. Thank you, sir.
Not at all. Okay, and about 6 1/4.
Thank you.
Okay.
Thank you,
All
sir.
right.
Have a nice
Thanks
day.
a lot. Bye-bye, Daisy.
Bye.
Nems, your turn. Nems.
Good afternoon, sir.
Hi.
Do you hear me, sir? It's clear?
Yes, I can hear you. I've been funny. Sorry.
Okay.
I'm just
Okay,
pretending
sir.
I couldn't hear you.
Yeah.
I can hear you, but speak up. Yeah.
Okay. I just want to pursue my application as a caregiver. I am a graduate of Bachelor of Science in Radiologic Technology. And now I am currently working here in Kuala Lumpur as a caregiver around 2 years. And I have a certificate also as a caregiver. Do I need to put in my CV about my previous experience? Because I worked before in Saudi Arabia and Abu Dhabi as a radiologic technologist.
Yes, you'll have to. That must all the details must go down there. And what you can use is, I mean, I know some people would argue that it's a step down from being a radiologist to being a a caregiver potentially, but that's life. That's life. But that experience will be good to show the employer, because it means you've had a medical background, you've been involved in a medical area. And also, again, I feel for UKVI, I mean, I don't want to guess what your age is. You don't need to tell me. But
I am 46 years old
okay, well, you
already,
told
sir.
me. Okay, that's fine. That's fine.
I am proud to be a 46 years old.
Okay, salamat. Thank you. Now,
Yeah,
look,
thank you, sir.
The point I'm trying to say is, you will fit in very well in a nursing home. Because
yes,
most
of course.
the people are older, you've had some experience, you've been doing these things. So this is the whole point about it, is you've got to think. You've got to use your brain. You've got to look at this as somebody else looking at your CV. anything that's going to help you strengthen your case, the better. Okay?
Okay, sure. So I am willing to take an IELTS.
Well, do my test first, and then I'll tell you
Yeah.
whether I think you should.
Sure.
Okay?
Okay. Thank you very much, sir.
Not at all. I mean,
Okay.
you know, I think you're probably okay at 6, but I'd like you to do my test first. You just need to let Eve know on, you know, WhatsApp or admin. It's on the flyer if you received that. It was also, I hope you took down the number as we were going through this, but you know, she'll send you a test to do and send back. Okay?
Okay, sir.
Send it back with your resume. All right?
Okay, sir. I'll send my resume, my CV or resume.
Yes, that's right. Yep. Great.
Okay,
All right, then.
okay.
Thank
Thank you,
you.
sir.
Salamat.
Okay, bye-bye. Salamat.
Bye. Okay, I've got no more hands up. So have I answered hopefully all your questions? Is there anybody who's got any other question? We're down to 35 participants, so I'm assuming that we've probably answered most of the questions. Are there, just out of interest, Rosalind, the reason we say there's a hand up thing is actually on your Zoom. It's on your Zoom. I had to keep changing pages otherwise. Yes, Rosalind.
Good afternoon. I just want to ask. At the moment, I am working currently in Malaysia as a caregiver. I've been here for 9 years and 9 years of experience also. I've been working in the nursing home before for almost 3 years. Then I work privately at home taking care of old people with different kind of diseases. So, is it necessary that I have to enroll again for FEMA to get the certificate?
Could you repeat that last bit? Do you have a certification of any sort?
I'm holding a certificate of caregiver, sir, but
Okay.
not from FEMA school.
No, it doesn't have to be from FEMA, but what we need to do is see it. I need to see it. I need to see the transcript of record that should be with it, so we can see what you've actually done and covered. You know, and if necessary, maybe there's something. If we think it's necessary, maybe it's something you speak to Savio about getting a quick update or something of that nature. I don't know until I see the paperwork. And you need, if you're thinking of going ahead with this, you need to do your English test. Eve's sitting there in the corner there. She's there. She's got. She'll give you the number if you haven't already got it. So that's what you need to do. I mean, on the experience side, great, no problem. Okay. As to your certification, I don't know until we see it. With FEMA, I've seen all their paper, not just the paperwork, but the actual syllabus. I can see what's being covered. And again, I keep saying this is not to do with satisfying the employer. This is all to do with satisfying UKVI. It's making sure that they are comfortable, that you have the right experience. Okay. So does that answer your question?
Okay. So I get one more question.
Okay.
Are you the one employer for us, or if any standby employer from there that willingly to apply for us, can they come to your office and apply for us? If able, we will pass the elites.
Is this to check that we exist? Is this to make sure we really do exist, that we really are a company with an office and people in it, and that I'm not sitting in Antarctica doing this Zoom? The simple answer is when we're out of lockdown, of course you can, but we don't normally work on a Sunday or a Saturday, so it has to be during the week. What we've been doing generally is every other Sunday we've been doing a seminar, but we have to do them by Zoom now. And from there, we've had people coming in on the Sunday who can only get Sunday off to submit their paperwork. But honestly, if you can WhatsApp it, just photo and WhatsApp it to Eve. She'll download it and sort it out, or you can email it to me if you have it on an email. I'm guessing you won't have, so it's probably going to be a WhatsApp. The same with your English test, is we'll send it to you, and then you need to fill it in or complete it and WhatsApp it back. So you can just picture it and send it back to us. So at the moment, that's what I would recommend, because otherwise nobody's going to do anything while there's lockdowns around, because we can't go anywhere. Fortunately, Eve had permission to come to the office from MITI, so she's here legally. Me, I'm a foreigner, and it's a different form altogether, so I have no permission, but I'm only 10 minutes away, only 5-6 kilometers away. So the simple answer is, of course you can come to our office. What I would say, though, is ring us first to make an appointment. Ring us first to make an appointment, okay? But in the meantime, what I would say is to, submit your paperwork by WhatsApp or by, if not WhatsApp, yeah, I think WhatsApp's probably the easiest, or email, okay?
Yes, sir. Thank you so much.
Not at all. And again, I'm harboring on about 6 for you, 5.5 to 6. You're borderline for me, so I'd like to see your test results, okay? Because I keep saying this, I don't want anybody booking their IELTS until they've done my test. I really don't want you to waste your time, money, and effort, and actually perhaps demotivate you from taking IELTS again if you don't get the right scores. So I'm really trying to save you money. You're all very welcome to do IELTS. I'm not stopping you from that point of view, but it won't be because I've recommended that you take IELTS. It's because you've decided to do it yourself. Okay?
Okay, sir. Thank you.
All right, Rosalind, that's fine. Nems, you've got your hand up again, or you just didn't bother to put it down? No? Okay, any other questions, anybody? Because it's gone 5:30 and Eve would probably like to get home. No, I'm only joking. I'd probably like to get home. But any other questions? Happy to answer them. Well, you've got me here, but if you haven't got anything and you've understood what we've talked about today and you're happy with that, fair enough. Okay, Remy, are you happy with the answers? Not at all. Not at all. Well, thank you. I don't know if any of you had a nice time talking to me, but I try to give you everything. The one thing I can tell all of you is my wife and I have had a huge amount of experience in doing this. And it was incredibly exciting to us when they said that the senior carers were again being accepted for the UK. But tinged means connected to that excitement is the uncertainty still that we will all have making the first applications for senior carers. And that's simply because it may be a breeze, it may be really simple and I might be worrying unnecessarily, or they may make it still quite tough in terms of the requirements and interviews and things like that. I don't believe they will, but I can't be more honest, and that's why I keep repeating it, than telling you that I don't know. I just don't know. When you have a nurse, for example, going as a nurse with NMC approval, very straightforward. Because once they've been accepted by the NMC, the Nursing Midwifery Council, it's a rubber stamp. As long as they've done nothing illegal, they'll automatically get their work permit and visa. A nurse going as a senior carer, there's always going to be a question mark until we send the first ones through. We're going to be doing that fairly soon now for the first 3. Because are they going to say, for example, these people are too well qualified? They should be going as a nurse. Well, my argument is, well, they can't go as a nurse because they haven't actually completed the requirements, and therefore they cannot apply as a nurse at this time. But that's my opinion based on our experience. IELTS 6 is my decision. It's not what they ask for. They will actually accept a lower level. But I know that IELTS 6 is about the lowest we can go to, and make sure that you can communicate clearly with your colleagues, with service users, and with their families, in order to make sure that you don't make some terrible blunder or mistake through lack of understanding. So a lot of what we're doing is based on our experience over 20 years, because I honestly don't know anybody else that's still doing this, who was sending people back in 2007, 2006 as a senior carer, to give you an idea. So we can only give you our best chance, best opportunity, but I think it's brilliant. And I don't think that there will be a problem, but I will keep warning everybody that we must make sure we cross the T's and dot the I's. That means we make sure that all the paperwork is correct, that we cannot be questioned on it, and that genuinely you are going there to work as a senior carer. So all of that is really important, or a nurse for that matter, if you're a nurse, even if you're starting as a senior carer. So please bear that in mind. And one other point I'd make, maybe someone like Daisy, who's in the Philippines. Again, we're particularly looking for nurses at the moment. We have a shortage of nurses as nurses, but they'll still have to go as senior carers unless they've got the right IELTS score. So please bear that in mind. And that goes for all of you. If you know any family, relatives, whatever, who are nurses, you know, Remy, if you've got any of your Malaysian friends who are nurses or whatever, please consider them for this. I think it's a brilliant opportunity. So that would be good. Okay, guys. Well, look, I'm going to end this now. I don't think there's any more questions. I know there are 61 chat notes being made, but I hope that I've answered them. Most of them, I think, are saying thank you. I'm glad to say. Can I still send my documents to receive a change? Yeah, yes. Send anything to. If we can't use them, we'll let you know. But really, at the moment, I'd prefer to have your documents. Certainly, your resume. At this moment in time, your resume is the most important thing. I want to see what you've done, genuinely what you've done, and where you might have to do more work in that area or something else. So please feel free to send all that in. Okay, so I think that's it. So guys, good night. Salamat for those from the Philippines. Terima kasih from those of you from Malaysia.
Thank you, sir.
Danjiban if you're from
Salamat.
Nepal or from whatever, and so on and so forth. So yeah, thank you.
Terima kasih.
Okay, thanks a lot. I'm ending the
Thank
call
you,
now.
sir.
Bye. Bye for now.
Can I leave?